most of them seem pretty pro forma, except this one. But there's a potential that either dispatch or the sheriffs, because both, there's a formula fee, depending on how the secretary reads it, either or both could end up here, which would definitely congest our week. So this one has to go to a probes. A probes has been working on it. Senator Hardy did ask me if I wanted her to come in, and I said we had Senator Lyons as chair, but also the chair of appropriations, because appropriations has some changes they're quite sure they're going to make to this bill. And it seems like when we are funding, which is our focus, we should be assuming, if the chair says she's got the votes to make the changes, that we fund what is probably going to be the end bill. And then we can have some contingencies if there are other things in it. But that's what we're working on. So Senator Lyons, why don't you, and I have a feeling we all, thank you for the fiscal fact. I was cleaning out my desk yesterday and came across 20 and 22. But I thought we might still be working on 22, so I now have 23. Okay, that's agriculture use lines. Okay. We have, we have summaries, we have side-by-sides. That's the funding piece, so. Okay. So this is a section by section and then the full bill. So Senator Lyons, tell us what's in this, maybe in a little more detail than the copy.
Thank you. Thank you. Thank you. For the record, Senator Ginny Lyons. And I had intended to come in and talk about those sections of the bill, or at least some of the financing work that has happened since we passed the bill, and then over the weekend to modify some of the financial pieces, the money pieces in the bill. So the policies that we have in the bill will not be affected by the finances. There might be a couple of tweaks here and there, but in terms of the amount of money, there will be changes to the bill. So one of the goals of the bill, as you know, was to increase caseload or to increase access to childcare and to have more kids be in the childcare facilities and more families access childcare.
We need more childcare centers too.
Yes, and so over the overall goal to improve financing and stabilization for childcare centers, to support the childcare workers, to support families so that the cost of care isn't so radically high as it is now. And then at the same time, this would allow for businesses to have their workers in place when they have workers seeking childcare. So over the past several days, the folks at JFO have been working very hard, and we've been listening. And one of the things that will have our focus in our committee was really looking mostly at CCFAT, but also looking at some of the policies that would, for example, enhance payment for early childcare, like 0 to 2. And then our other focus was on how do we maintain some quality incentives in place. So you'll see that, and that is part of the financing piece. But as we've gone ahead and looked at what are the implications of the increased funding that we have in the bill, we find that right now we might have a current caseload of 4,500 to 4,700 kids infant and toddlers and pre-K caseload in our child care
When you
center.
say caseload,
Kids,
kids, is that the total number of kids? When you say caseload, I see that as kids under CCFAP.
kids under CCFAP.
That's the kids under CCFAP.
Yes.
Okay,
And then in doing the analysis of what effect would this increase have, it's in our bill, it comes out to about 7,700 increase in utilization. So we'll see more, a higher caseload as a result of this work.
okay, but that would be kids. I'm looking at the section by section. It says you're expanding 150 eligibility for CCFAP. From
Yes,
150 to 185%. That's where you pick up the bigger caseload.
yes, we may, and we also may pick it up at the other end. Because at the other end, so right now, the CCFAP goes from 150 to 350. So we will be going,
And what other end?
the high end, high income.
Okay, is that, all right.
You want me to start over?
I'm trying to get
I'll
this
go right
straight.
back to the beginning.
You get from under 150, you get full payment, and then you get a reduced payment up to another percentage of poverty. Is that, okay?
So let's start over, because I was making the false assumption that you had already looked at some of this. So
No.
right now in the bill, out here in the CCFAP world, someone who earns 150% of federal poverty level or lower receives everything, a full cost for their children through CCFAP. The people who are up to 350% of poverty, so between 150 and 350, receive a subsidy, not the full, but a subsidy. What this bill does is it increases that lower limit to 185, so people up to 185 will be fully covered. And then we've taken it up to 600% of poverty, the federal poverty level, so that'll be a curve. So you'll get a less and less of a subsidy as we go up to the higher income level. And then there's a slope down, so we obviate that, we eliminate that.
And the cliff has been an issue, I know, for years. We've had testimony of people, frequently single mothers, who cannot afford to take a raise or a promotion because they lose more in lost childcare benefits than they gain in the raise, and they actually ended up worse financially for being promoted in their jobs. And we tried to deal with that, and it was very expensive, so we haven't. But trying to get a slope, and we've done that every time minimum wage comes up. If you push people over that edge, they end up not making it. So this is proposing, because you can't clip coupons like you can for food. You can't turn the lights out or the heat down. You need childcare, and you need so much of it, and your boss isn't going to let you only come in 4 days a week because you can only afford childcare for 4 days. So I think that's an issue this body has dealt with, I think, since I've been here.
Well, and because we've dealt with it for so long, and because we did look at changing the market rate for reimbursement, that did help, but it's still market rate. So within the bill itself, we continue with market rate. However, the
Market rate is what is being paid for childcare,
yes, right now.
not
It's
subsidized.
2019? I forget where we are right now, it's 2019.
Okay, so
Yeah.
it's not up to date, it's 2019.
It's behind.
Okay.
It's better than what it was, but it's still not good. I see Katrina, oh, boy, there's a friend. Yes, so the policies in the bill are, as I said before, they probably will not be affected by some of what we're seeing in terms of balancing the finances. I know there are a lot of things that you can do in here that we didn't look at in our committee, because we dealt with CCFAP, we dealt with the Child Care Financial Assistance Program, which is in our Agency of Human Services. We did not look at other financing options. So the increases that we've put in place will help families dependent on their income, and it will be purely based on their income. So then the way it'll be structured within the agency will be, there'll be a enrollment-based reimbursement to our child care centers. There will be some support based on how many little ones you have in your child care center.
That's the baby bump.
That's kind of a baby bump.
Cost we require a lot, yeah.
So, and then on the quality piece, so everyone will be paid exactly the same rate. However, if you are a 5-star, you'll get a yearly bonus. And if you move up to a new level, you'll get that bonus. You'll get a bonus, a one-time bonus. So that helps it does two things. One, it provides funding for a center that really wants to move forward and they don't have the resources to do it now. And two, it rewards those who are achieving a higher quality child care program. So as you look at the bill, I would say the work that Joint Fiscal has done most recently will help inform exactly what is needed. It's slightly different from what is currently in the bill. As I said, things keep moving. And there may be some changes to the way quality incentives or grants, capacity grants are given to centers. There may be a change in what we call readiness grants, how to prepare for improvements or new entrants. So there'll be some changes that you make, but those changes will be, I would think, will be consistent with what we have in the bill. I did not intend to go through the whole bill with you.
No, that's fine.
Okay,
That
I
draft
just want to make
is
sure. But in our entire conversation in health and welfare has been, the next step is down the hall, and that's here. And we understand that the estimates that are in the bill itself may be higher than, we try to keep it below the RAND report, which we look at as the platinum. And we want to keep it, we have it slightly lower than that, in fact, very much lower than that. But we also understand reality and that there may be some adjustments that you can make in here that will identify exactly how much we need. And as I look at what Joint Fiscal has recommended, it's much lower than what came out originally on Friday.
Okay,
Is it
my
Friday?
understanding is the biggest thing that wouldn't impact us, but it's likely not to be in here, is a whole reorganization of the health and human services and education, and that wouldn't impact us.
Well, but
That may be the biggest.
the issue around administrative costs for making changes, there are two issues there. One, going ahead with an administrative restructuring at the same time that all of these changes are happening within the child care program itself are very challenging. So we had talked about a period of transition, or at least ability for the agency and others to evaluate what can and cannot happen within that administrative restructuring. And then secondly, we don't have, I don't think we have an accurate cost accounting for any administrative restructuring. So those things for me, and I think I speak on behalf of the majority of the committee, having those administrative changes are less compelling at this time than are the improvements to financing and the policies that we put in place specifically for child care center worker and family improvement.
Okay, basically, what we're doing is we're upping the eligibility. We're upping what we pay the providers. We're upping the level of income at which you get a subsidy and then kind of ramping it down. And I know there's readiness grants, which I understand is those are not in there yet, right? That's
No.
part of what
That's part of what I think
folks is looking
should
at.
happen in appropriations.
Yeah, that there's
Yeah, so that's as I said.
incentive bonuses and things we have been paying, I think, are going to get wrapped in to that, and that's an appropriation. What we need to find out is how much money we need to raise in order to fund to see the raise in rates, the raise in eligibility, all of those little things.
Right, so if you look at eligibility expansion, administration for the changes that are in the bill just for the funding piece, financing piece, the readiness grants, which will probably be in appropriations, as you said. Then there's the parental leave benefit. And then all of that together, total estimated appropriation, and then subtracting what the governor's budget has in it, the base budget, subtracting that 40 million, or 49 million actually, then we're left with about $35 million. As you look at that spreadsheet that will come to you and that you have from joint fiscal. So that $35 million is significantly less than raising 90 or 100. Right. The next year will also, the 2025 will be another look and another challenge.
So, any questions for Senator Lyons?
Good afternoon, Senator Lyons. This isn't a pure money question, but from all of us who worked on this over the years, whenever we do something in childcare, we end up hearing about what's the impact on different sorts of centers and down to like neighborhood providers or that kind of thing. Can you say a little bit about how the finances of the bills as you envision it affect different sorts of providers?
That's a very good question, and which is exactly why having the incentives in place, or those little bonuses on a yearly basis, are important. Right now, the higher level you are in the STAR program, then better reimbursement you're getting. So what this will do will be to offer some level funding for all centers, and so that'll help the ones that are smaller and maybe less well financed. But it will then the little bonuses that go in as people work to improve will help them a great deal. So the CCFAP itself will help as well, I mean, just in terms of paying for kids in a new way.
Basically, everyone's going to get the same rates. So But those that reach a higher level, which is basically training and education of staff, will get a bonus. And then I hear you say the bonus would also, like, if you're trying to raise your rates,
If you improve and go from one
Okay.
step to the next, then you get a bonus.
Okay.
And that'll help you to continue to improve. But the point is that now with the level funding, the funding level will be greater for those who are at the lower, I hate to call it lower quality because they're all good.
Yeah.
We have the best in the country in terms of the
tend to be
mixed delivery.
smaller. This also
Yeah.
goes for home providers?
Yeah,
Okay,
our home centers,
Yeah.
anyone that's licensed or regulated under the state.
okay. So
And we have a
everybody's
list of,
gonna get
we've, all of that is broken out and Katerina Lysias and others in CDD, AHS has all that data for you and we have gone through it. The,
Just one quick follow-up. So for centers that aren't certified at higher levels, like home centers, some home centers, whatever, the base level of funding goes up. So that's one helpful thing. Is there money anywhere in the bill that says, we're going to help you move to a higher level? And there's money, we do it in technical assistance programs and all sorts of other areas, but is there money that's earmarked to help people improve the quality?
that's a good question. It's not directly in the bill itself, but it's something that with the funding that we have might be made available through the agency. And certainly, the retention grants that we put in place last year and the loan repayment that's in place for workforce will be helpful.
I think that's money that's going into the readiness.
It's gonna have, that's the readiness piece and that, it could be reallocated in a way that does exactly what Senator Bray has identified.
But I think what they're hoping is because we're increasing what we pay, and we seem to pay the bulk of the childcare costs, that because we've upped our level, the market rate, that will allow the center providers to raise wages and which they need to do to attract qualified people, but we haven't been paying them enough to help them do that, to enable them to do that. So I think we're gonna move on.
Oh, could I say one more
A
thing?
question.
He has a question.
Yeah.
You keep using the expression child center. What does a child center encompass?
As I said before, it could be a center that's part of a parent-child center. It could be a home-based center. There's someone's home that they have applied to and been supported by the state or licensed by the state or registered to the state, excuse me. And then we have licensed centers. So they can be affiliated with a Boys and Girls Club. They can be affiliated with
So it's not
independent, private
size,
organizations.
it's designation of expertise.
Designation by expertise, by who are the teachers, I'm the assistant. So,
Oh,
Yeah.
yeah, you can have, what is it, less than 5 or you can have kids in your home and not be licensed, so
Right.
you can watch your
I forget
kids
the
and the
number.
neighbors' kids. It was,
I remember.
oh, 6, okay, we have 6, do we have 7?
Yeah, yes.
Yeah, and I could, it could, but unlimited if it's you and the neighbors or, yeah. But when we did that transition, there are still some small individual people that are providing care for a small number of children. They may provide care after school for a couple kids, but these are the licensed state centers. The ones that aren't licensed don't get paid by the state.
And by increasing CCFAP, by doing what is happening in the bill and all of the, beside the financial assistance programs, but having other elements in the bill, there may be centers that decide they want to be registered or licensed. So that's where you see some expansion.
Okay,
Could be the other way too, but I did want to say one other thing, but I won't.
okay. You think it's
I-
important?
It was going to be about total cost of care and how we made a decision to move away from total cost of care and stick with market rate, but I think that's probably not necessary at this point unless you decide to go to total cost of care.
Okay,
At least that's right.
all right.
There is a report coming back on what total cost of care might look like.
So we're gonna go on to Katie. Katie, you're gonna walk us through the bill,
Sure.
and Sarah, you've got a piece of information. I'll be right back.
Thanks.
Good afternoon. Katie McNutt, Office of Legislative Counsel. I'm going to try to share my screen and show you my section summary. So it's my understanding that your focus today is on CCFAP, Child Care Financial Assistance Program. So I'll limit my review of the bill to those sections of the bill. So as Senator Lyons has already explained to us, the eligibility under this proposal, the number or the population of eligible families would expand. Right now, families at or below 150% of FPL don't have a copay for their child care. This proposal would increase those families up to 185% of FPL. Similarly, the total group of families that can participate would expand under this proposal. Currently, families at or up to 350% of FPL are served under the CCFAP program. That doesn't mean they get a full benefit. It's a sliding scale. So folks who are currently at 350% still have a copay, but they're still receiving some type of subsidy under the program. This proposal would be to expand that group that's eligible up to 600% of FPL.
So on that point, is there people that are currently at the 350%, as we expand to 600%, all things being equal, would their benefit go up in this current scale, or would it just stay the same and now we're extending more of an adjustment for those beyond the 357%?
I believe the scale would change, but that's a better JFO question than for me.
There's a chart.
There's a chart, yeah. Okay.
Mr.
25 continue.
Thanks. This is not just for this witness. You folks have been dealing all session in a dialect, different than the dialect. So I appreciate, I know with the federal poverty level is, but it's like when I'm dealing in French, I don't think it French. I hear it in French and I translate it to English. I had to translate that.
Got it.
Okay, also,
I will work on
if you
that.
could use numbers, actual dollars and cents as well as percentages.
I don't have dollars and cents for
We'll do that when
the
we
FPL.
go.
That's
Okay.
joint fiscal.
Don't assume we're well versed.
Got it. Okay. Are we okay with CCFAP for Child Care Financial Assistance
I
Program?
finally figured that one.
Okay.
I listened to all of Senator Lyons' testimony,
Okay.
bluffing, and then I finally figured out which is.
Good, good. Okay, so I'll keep using that one. That one's a mouthful. So the next three sections that we're going to look at, we're sort of transitioning. We have been thinking about the population that is eligible for the program. And now the next three sections look at how providers are reimbursed under the program. So section 3 of the bill is session law. It's a one-time rate adjustment for providers. And that adjustment takes effect on January 1st of 2024. And it applies to the care of children who are 0 to 4 years of age. And it would also pull in 5-year-olds who aren't yet enrolled in kindergarten. There are some 5-year-olds who maybe missed the cutoff, their birthday missed the cutoff, and they're still being served in a child care or pre-K program instead of at an elementary school. So there's this one-time adjustment. The adjusted rate will account for the age of the children being served, meaning that infant rates are usually higher than preschool age rates because the number of adult to child ratio is different for infants than toddlers and preschool age children. So there will be a one-time bump on top of the current 5-star reimbursement level. There'll be an additional 38.5%. And that will be across all providers. So all providers will be getting the 5-star rate plus the 38.5% bump. And the only difference will be, are they a center-based program or are they a home-based program? And there might be some nuances depending on the mix of the age group that they're served. So far, so good?
So far, so good.
Okay. So that's a one-time change. And then the next two sections are ongoing law. They'd be in the green books. So first is section 4. This is an amendment to the existing section on payments to providers. And one thing to make clear is that there are children participating in CCFAP who are school-age children. CCFAP goes up to 13 years of age. So the new methodology that's being discussed under this proposal is for 0 through 4 years of age. The existing methodology for calculating provider rates for school-age children will continue to be the same. So the amendment in section 4 says that this existing methodology will continue to apply to children 5 and above, school-age children. Section 4A creates a new payment methodology for the 0 to 4 age group. So it establishes an ongoing payment schedule that will be applied after this one-time rate adjustment happens for children who are 0 to 4. And again, this adjustment would account for the age of the children being served. Also, providers in the same child care setting category would receive the same rate. That just means that all of the center-based programs are treated the same and all of the home-based programs are treated the same. Provider reimbursement rate over the previous year's rate will be adjusted annually on July 1. So there'll be an automatic escalator that will be aligned with, I don't know how to pronounce that. It's national NAICS, okay. So there will be a scale that increases each year, and this would follow that scale as it increases. The providers, this would provide an additional enhanced reimbursement rate for the care of infants and toddlers. This would be set by the commissioner. And then we get the last two bullets under section 4A deal with the incentive program. So there would be a flat incentive for all providers who are considered 5-star programs. STARS is the quality evaluation within CDD step ahead recognition system. So everyone who is a 5-star provider will be receiving a one-time incentive payment every year that they maintain that 5-star rate. It also provides an opportunity for individual programs that are earning less than 5 stars to earn that same flat incentive bonus every time they move from a lower star to a higher star. So there's potential if there is a provider who's a 2-star rate and they're working to achieve a higher star rate, that over time they could receive that payment several times and possibly land at 5 stars eventually and maintain that ongoing annual 5-star incentive payment. Section 4B creates the High Quality Early Care Education Special Fund. And this special fund would be for the incentive payments that we just discussed. So those are the prime sections that deal with CCFAP under the proposal that came out of Senate Health and Welfare. So I'll pause there because I know that's your focus for today.
Committee questions?
Just a question. What effect, if any, does this have on the rate that a particular center or provider can in fact charge?
Well, there's no limit right now on what a provider could charge, so this would continue to allow
So if they could charge,
providers.
for example, a rate that is substantially higher than payment, they would get the payment and then whatever additional would come from the parent, is that it?
So a provider can set whatever rate that they would like to set. In terms of the provider reimbursement,
Mhm.
that will be sort of set by
Yes.
this.
Mhm.
And so that will not change. Even if a provider is charging parents a certain rate, they'll be reimbursed according to this particular schedule for their children they're caring
So
for.
as a
under
practical
CCFAP.
matter, this would be the minimum rate that they would be able to obtain.
The minimum, not necessarily,
Although
no.
that they typically charge less than the reimbursed rate, would they only get that less than rate?
Yes. Mhm.
Anyhow,
I know, I needed it, thank you.
so this is really relying on the market system. I'm sure we'll be monitoring it to see how well it works. I doubt that it's changed, but when we did the childcare worker organizing bill, the East and the West Coast seem to be pretty well endowed, and the center is pretty minimal. But I don't think there were many five-star places there either, so. But if you get a reimbursement rate that is livable, that it is realistic, then the chance that more people will open increases. Right now, why open something which you're almost guaranteed to fail? So,
Well, there would be no expectation that a center would open or stay in business at a rate less than that they can get on this program.
Yeah.
You would not expect to see anything at a lower price.
and I think when Senator Lyons talked about the total cost of care, he was talking about what does it cost to own, rent, maintain, heat, water, all of those things that goes into the total cost of the center, and how does that play out with the rates you can expect, and that study's coming, right? So if,
That is one of the, yes, that's a section of the bill. They look at provider total cost of care and how to define total cost of care.
which also will vary from center to center. I mean, if you're renting a building and it's got water and septic attached, it's one thing if you've got to pay your city water and sewer bill. And there was a child care center in Waitsfield, I think, that was having trouble because there was a federal regulation about water. Okay, and we can't change that. There are other regulations out there. Okay, questions for Katie? Thank you. We're easier than helping. And now we're gonna- Then we get to the money people, then we're not nice at all. Okay, Joyce, I don't know if it's you,
Katie needs
Nolan,
to,
or
Katie
how-
needs to-
Katie forgot to unshare.
What did Katie forget to do?
Forgot to unshare her screen.
Uh-oh, where?
There it goes. Okay, I'll get Joyce.
What did Katie forget to do?
Joyce, Joyce, we're good.
Oh, we're good, okay. She just forgot to take her screen down.
Yes.
She didn't forget to tell us something, okay. I don't care about her screen. And I don't know if it was Katie or Jill who was controlling the screen.
I think Jill
Okay,
has all the power.
Joyce.
Thought you were gonna get away, but
I need to share my screen. Okay, well, I know every time I've walked by Health and Welfare, Joyce and Nolan have been either there, standing in the door, or consulting in the hallway.
Mhm.
So I know you guys have been doing a lot of work on this. And Joyce, I'm gonna turn it over to you. Basically, and I don't know, are you gonna be working off that? No.
No, I can answer questions about that one
Okay.
picture, but I'm going to give some background information and try to illustrate how the new plan is a little bit different.
Okay.
So for the record, I'm Joyce Manchester with the Joint Fiscal Office. You have slides in front of you? No, you don't. Yes, you do. They have been posted on the website, but I'm also showing them here on the screen.
Okay, that's good, but that helps people at home too.
Okay, so my task was to try to illustrate how the family, I should take my mask off, sorry, how the family early care and education contribution, I'm calling it early care and education rather than child care. So that's what ECE stands for. And we're going
Learn
to,
a new acronym.
yes, because child care is more than child care, it's early education. Okay.
Yes, some of us learned that a long time ago.
Yes. Yes, okay, so I think you've heard a lot of this background before. I'll just say it quickly and you can certainly ask questions as we go through any of this. So the expectation is that currently families with income greater than 150% of the federal poverty level.
You know, what is that?
Yes, so at the end of these slides,
Okay,
it's a
just-
handy dandy chart.
I have it on here somewhere.
So you can see for a household of size 3, the 150% line hits at 37,290. And for purposes of CCFAP, this is good to know, no household is smaller than 3. So a single parent and 1 child would qualify under the family of 3 dollar amount.
Okay, if they were making the glorious sum of $37,000 and 290. Yeah.
So up to that level, they would pay nothing for childcare in the CCFAP system.
Okay.
Now, currently, let's go back to that other slide. Yeah, so currently in the 25% bucket, just above 150, so 150 to 175, that family would pay $25 per week for childcare services, full-time.
From a number of the childcare service providers, that they were not collecting that because the kids would go hungry if they did.
That is true. However, that $25 per week continues to increase by multiples of 25. So 175 to 200 pays $50 per week, and so on up the scale, right? So that a family with higher income is paying a higher contribution every week. And that continues until 350% of the federal poverty level, where the subsidy stops and the family is expected to pay full freight for childcare. Okay, and as was just discussed, some childcare centers charge what CCFAP is providing as the reimbursement per week, and some are charging more. A few are charging less, and they would be reimbursed by CCFAP only up to the amount they charge, right? But many charge more, and the families are expected to carry that extra charge as well. Okay, so we're good. Oh yes, so this is relevant also. So I've been focusing in my modeling on center-based care, and the center-based care 5-star amount, so this is the top amount that CCFAP would pay, currently is $17,250 if you were to average infant, toddler, and preschool kids together. Okay, so that's the number that's in my head for the status quo, $17,250 per year for 1 child full-time at a center, okay? Just to show you the current system, this is a table that shows you how the payments differ by quality level. So remember, there's a STARS system. Childcare centers are ranked from 1 star to 5 stars. Home-based providers are also ranked from 1 star to 5 stars. On the left, we see the current reimbursement rates for licensed care facilities. So you see An infant, for example, full-time, 1 star is $290 per week, and it goes up to 5 star, $349 per week. Okay, and then that rate varies by the age of the child. So toddlers, $280 to $328 per week, preschool, $275 to $325. And school age is also on this chart, although we're not focusing on school age for the changes here.
That was more after school and
Yes.
school vacation.
Correct. Yes, and you can see on the right-hand side, you have rates for registered homes, and you can see that those rates are lower. So the 1 star is at $200 per week for the infant full-time, goes up to $225 per week for 5 stars. So those are lower rates. Generally, these are homes with 5 to 10 children of mixed ages. You're limited on how many younger kids you can have and so forth. It's a much smaller facility within a home. Okay. Okay,
Can I ask a question?
On the chart, what's extended time? What does that mean and when does that apply?
right, so some childcare facilities offer more than a standard day, and maybe some in the state, I don't know this, but maybe some offer some weekend care, I don't know. But for example, if you're operating from 8 to 5, but you allow some kids to stay an extra hour, maybe that's extended care. Okay. All right. So here are some possible changes in CCFAP going forward. I'm being agnostic here and calling them possible changes. Okay, so first off, the governor's proposal would decouple the CCFAP reimbursement rate to providers from the STARS rating system. So this is what Senator Lyons was talking about. All the home-based centers would get the 5-star rate, and all the centers, childcare centers, would get the 5-star rate. Now, those are 2 different levels. And I think, yes, in the sub-bullets here. Okay, so all the centers would receive the $17,250. That's the average infant, toddler, preschool rate per year if this change were made effective this year. And all home-based care providers would receive $11,258. So you can see there is a differential between the family home-based care and the early care and education centers. Okay, so those are numbers to keep in your head. And then the RAND report calculated that the cost per child of a high-quality care system at the centers would be about $28,100 per year, or about 63% higher. So the decision was made by your fellow legislators that that would be a very big step to take in 1 year. And so instead, they chose to go for a middle ground reimbursement increase. And that's what we'll be looking at today.
Okay, is that where the number that was bouncing around the summer of approaching $400 million came from?
So the RAND
Proposals and
report,
there were some numbers bouncing around. I think RAND came in with 279 million. There were other proposals. I think that everybody didn't pay anything, were up close to 400 million.
that might have been Let's Grow Kids.
It was low, okay.
Yeah, so you are correct that the biggest gap identified in the RAND report was $279 million. Yeah. Okay, and we're going to get there in just 1 second. Okay, so yes, the governor's proposal would decouple STARS from the CCFAP reimbursement system. They would keep the STARS rating system so that you would know if you're a level 1 to level 5 provider, that you would be paid at the level 5 rate. That was considered to be an equity change. Okay, so I think we just finished that. And yes, and now we're on to the first picture. So I was trying to illustrate how the reimbursements correspond to the family contribution for early care and education. So this is my attempt to show if you look at family poverty level along the horizontal axis, we've got 0%, 200%, 400%, and so forth. And if you look at the share of the family's income that is paid for early care and education under the CCFAP structure, look first at 150% of the FPL. So I'm on the far left corner here. And families are paying 0 until you get to 150% of FPL. And at that point, they pay $25 per week, which is $1,300 per year. Okay, so $1,300 per year as a share of income at 150% is what, 3.5%, where the first vertical line goes up. And then families up to 175% of poverty pay the same $1,300, even though their income is increasing a little bit up to 175%. So that's why that line slopes down. And then we get to 175%, that family is now paying $2,600, right? So they're paying $50 a week or $2,600 per year. So that's the share of their income. So that's the reason for the jagged line there. That continues till we get up to 350% of poverty. And just over that level, the family is paying the full freight for early care and education. And if this child care center is charging at the CCFAP reimbursement rate, $17,250 per year on average for kids 0 to 4, they would be paying 20% of their income. Now, it is true that many centers charge more, so there would be some bump up for many of these families, right? They would be paying a bit more than is shown in the
Well,
chart.
that's actually better than some of the national statistics talking about $30,000
$30,000,
a year that
some centers might
Some.
charge.
is being charged.
So one thing to keep in mind is that infants are generally more expensive than
Yes.
3 and 4-year-olds, and I'm using an average here. So,
Okay, so if I happen to live in an area with, you know, I pick up 5 infants, because a couple people had twins, that's gonna blow my costs, or I'll have to more employees to cover that.
yes, and of course, from the family's perspective, if you're above 350% and you have twins, this line really gets up. Yes.
So this is the status quo, and right now, in the status quo, that 10% threshold doesn't really do anything, right?
Correct. So I put in the 10% threshold because the bill back in 2021 said, families should have to pay more than 10%. Okay, so that's my attempt to illustrate the status quo. Okay, so now we're going to use the proposed, what's called the middle ground CCFAP reimbursement amount. We also need to make a little bit of a switch to get to $2023 because inflation is definitely out there these days. We're using 5.5% to reflect wage inflation in educational services. So that comes from a Vermont Bureau of Labor Statistics survey. So the proposed middle ground reimbursement amount to early care centers, so this is for centers, not for family home care, would be $24,265 per child per year on average across those age groups in 2023 dollars. Okay, so that's the amount that we're aiming toward. The bill would start family payments of $25 per week at 185%, not 150%. So that's a change in the bill. Well, that's the bill that came over to you from Senate Health and Welfare. Again, CCFAP pays the full amount up to 185%, but then we would continue the CCFAP payments going up by $25 per week with every 25% FPL increment, right? The same structure. We would continue that up to 600% of FPL in order to get rid of that cliff. So that means for a family of 3 up to 149,000, for a family of 4 up to 180,000.
Okay, so that would also be a single woman with 1 child.
Family of 3.
Yes, that everything is a family of 3.
Yes, and keep in mind that the subsidy at the very top is very small because
Okay.
those folks are paying almost the entire full freight, right? So is the next slide, okay, so this shows If you adjust that 17,000 where we are now, 17,250 by inflation, you get to the 18,199 or weekly 350. So that's what CCFAP would be paying in 2023 dollars. Okay. The middle ground is at 24,265 or 467 per week. The RAND high quality average reimbursement adjusted for inflation, we went from 28,100 to 29,646. Okay, so this is just to show you the numbers in 2023.
The red report would be paying 100% of the cost. What's the ratio?
No, the ratio is the ratio to the RAND amount.
Okay.
So we're currently at about 61%, and the middle ground would move us to about 82%. Okay.
This may have been answered another time, but if someone participates in the program, do they tie themselves to certain increases in any
Oh, the
way?
provider?
Yeah,
I don't believe so.
so what is to guarantee that we don't start saying, we're gonna pay X amount for everybody?
So-
And they just keep increasing that amount quite a bit. I mean, you may have heard of the childcares in our area, LoveWorks and HeartWorks, they're looking at a 40% increase this year. It's about the amount we're trying to
Yes, I know.
give
this is-
to communities, but that would be a real shame if they did that increase this year, got the money and had another increase.
Yeah, so there are lots of factors at play here, as you can imagine. The expectation is that because centers and family homes will be reimbursed more, that they will bump up their wages for their providers. And that will enable them to hire more staff, provide more slots. And at the same time, the families who are looking for care will get the same, from their point of view, they're paying the same amount of money or even better, actually. We're being a little bit more generous on the CCFAP reimbursement. But the big change is the middle income group, where the subsidy is now going to be meaningful from 350% up to 600%. Well, less meaningful as you get to the top, but it will help them out at that level.
And we're
So-
tying the one-time money we're giving them to paying their staff better.
So that's, the one-time money, I would like to defer a little bit till we get through the CCFAP subsidy reimbursements,
Yeah,
but
yes.
for sure, let's get back to that,
Okay.
okay?
Because I think this, before you came in, we had this similar discussion with maybe Katie or
Oh, no, I was here. I was
You were
here.
here, yeah. that basically the market, we're gonna up the rate, the intention, and there are also some readiness grants that are
Yes.
going in
Yes.
to help, but the expectation is if you're getting more, that will enable you to pay more because people won't work for you at what you're able to pay now.
Right.
And that if you can open a lower cost center and still make a profit, that the market will cause that to happen if the only other place in the area is a very high price center. But we will be monitoring that.
Two things. One, a comment on that last question. I'd be interested in looking at some sort of penalty or to keep the overall price of the childcare center. If it goes up to a certain point, that the subsidies could start to decline, just to try to keep things reasonable, because I am concerned about that. I don't know if perverse is the right word, but perverse incentive to continue to raise the rates of childcare. My question has to do with these numbers on this slide here. So the 24,265, did the policy committee determine that there is a high variability in childcare costs across regions of the state? And should this be accommodated for any consumer price indexes for what it costs in, say, the Chittenden County metropolitan area versus in other areas? Or is this the number that's currently proposed across all of Vermont?
So currently, the CCFAP rate is the same across the entire state, and this would not change that, right? So it is true that so you can imagine that most centers in Chittenden are charging more than the reimbursement rate, right? And those parents are footing the bill for the extra. And part of that is because wages are higher in the Chittenden area, and they have to attract staff to work at their organizations. It's also true the wages are higher in the Chittenden area, so we hope the families can afford to pay the higher rates.
I think, again, when we
through childcare last time with the unionization thing. The testimony from providers in Chittenden County, I doubt that it's changed a lot, is that they had less than 10%, sometimes 1 or 2 kids on CCFAP. And you got to the center or the kingdom, but you got to the poorer areas of the state, and they had 1 or 2 kids that weren't on CCFAP. So it was the centers providing care to poorer people that were getting hit the most, and they could therefore least afford to provide the highest quality care. But in Chittenden County, and now you're gonna pick up a lot more people in Chittenden County that won't get full subsidy, but will get some subsidy. So it should help.
And I would also add that paying all the providers at the 5-star level is also supposed to help with those equity issues. Because, if you're serving mostly low-income kids and you can't raise your rates, it's tough to provide the high quality of care. But if you're reimbursed at the higher rate, then you have a little more flexibility to up the game. Okay, so sorry.
Follow up on that, since I can see the tax commissioner back here. I'm curious, maybe he might have the answer later on, but do you know of any other Vermont state tax policy that does vary reimbursement rates depending on the region for consumer prices, like in Chittenden County or elsewhere? Does anything come to mind?
I do not.
Property tax credits vary by region.
Based on the rate.
The resi rebate, that's not a tax code.
That's true.
But that's one that's tied to housing pricing or rental pricing in different regions. You just have to look at the outlier.
I'm intrigued to understand more how that same type of model might apply sensibly to this reimbursement rate.
Okay, except we have today and tomorrow to
Yep,
do
yep,
this. So,
Shall I keep going?
yeah, keep going.
Okay, so this is the new picture under the new policy, which now you can see the 0% of your income line goes out to 185% of the federal poverty level. Those families, 185 to 200, are paying the same $25 per week, so they're paying $1,300 per year. You can see that the schedule continues all the way out to 600% of the federal poverty level now, in order to get rid of that big spike. I mean, the spike would have been really big if we had not continued out to that level. And families beyond that 600% level are not receiving any subsidy through CCFAP.
And it ramps down.
Well, because childcare prices are fixed and the incomes are growing, so the
Okay,
percentage of income is dropping.
but, all right, when you hit that top, you're paying such a large percentage of the cost anyway.
You're paying full freight,
That pay
at
that's right, okay, but so that it's not the shock it is now where it is nothing, okay.
All right, good, okay. So, and again, this was just a chart for your information regarding FPL levels. This is 2023 dollars. And that's the end of my slides. I did want to address the question about the readiness grants. So the idea is that the CCFAP reimbursements would increase on January 1st, 2024. So the beginning of the next calendar year. And at that point, many, many, many more families would be eligible to apply for CCFAP and might want to use center-based care rather than their current arrangement, which could be nannies, it could be sharing care with other families through grandmothers in the neighborhood, who knows what it is. But many families who previously found childcare at centers or family-based homes to be prohibitively expensive would now be getting some subsidies. So in order to prepare both the CCFAP land for many more contributions and to prepare the childcare centers for being able to take in more families, more children. There's this 6-month onslaught of 25 million that is suggested here. We're calling them readiness grants in order to help the childcare centers maybe boost in wages for their current staff, maybe hire some people in anticipation of more kids coming in the new year, maybe to renovate their empty classrooms that they've shut down during COVID years and in the absence of sufficient staff to staff all of their capacity. Maybe it's to help incentivize some new centers starting up. So it's really important, we feel, that there be some money prior to the big expansion in CCFAP so that the childcare system is ready to accept more kids when that happens.
Is there anything they can't do with the money?
So I'm not aware of anything they can't do with the money.
Spring break.
Hey.
I think if you talk to childcare providers, they are desperate to increase wages for staff. They cannot find the staff they need. They need qualified staff. Those staff are either going to public pre-K programs where the pay is $60,000 a year, not $35,000 a year, and the public staff gets benefits on top of that, and they don't work summers. So if you're a qualified pre-K teacher
Right.
and you have that choice, which one do I choose?
Yeah.
It's pretty obvious. That you
I
choose.
hear you. It's just with what came up in our district, I didn't know that the ownership of the center was out of state in Massachusetts. Like, I think of the, one person not paying themselves and paying their team, two who desperately wants everyone's wages to go up. But, we do have larger childcare conglomerates or chains forming in the state that have out of state ownership. And I might give these folks a call just to better understand what the impact would be there. I get the average Vermont situation, but there are other larger centers that I don't think we want them to just do what they think is
Sure.
best.
And they're going to face market forces as well, right? I mean, there's a limit to which they can raise the prices and still have families show up on their door. Presumably, if this all works according to plan,
Yeah.
the capacity will increase and families will have more choices in where to send their kids.
Right. Not in the very short term.
Correct.
They don't have market
Right,
choices.
absolutely.
But the centers have to hire
Yes.
at the market rate, and if there's, within community distance, 2 other centers that are paying more in today's labor market, they're gonna have to compete, which is a good thing right now. I think these are all things we're gonna have to make sure we monitor, because what works in starting things up, we might wanna watch rates and watch.
Absolutely. I did want to make a few comments about the parental leave program, if
Yeah.
that's okay.
That is now attached to this bill.
Yes, yes. The idea very basically is that DCF would run this program, CBD would run this program. It would be a 12-week benefit for one parent per birth, or one parent per family with a birth or more. If you have twins, you still get 12 weeks for one parent. So the maximum benefit is $600 per week. People who, oh yes, and you must be working 30 days prior to the birth of your child, so you have to be a worker. People who earn less than $600 per week would get up to their average weekly wage. They would not get more than their average weekly wage. Okay. The 12 weeks was chosen to correspond to the Job Protected Family Medical Leave Act. You can take 12 weeks off from your job under FMLA and have your job guaranteed when you come back. It is true that in this setup of the parental leave benefit, you could take an employer-provided benefit, which could be your annual leave, or it could be a parental leave benefit offered by your employer. Maybe that's good for 12 weeks at full pay or something close to full pay, which you would prefer to take, right? you could take that leave for 12 weeks and then tack on additional weeks under this parental leave program. Okay?
But your employer would not be required to
That's correct.
protect your job.
That is correct. So
Could you
you,
take this first?
as part of your 12 weeks,
Yeah,
yes.
and then take 12 extra weeks, where you employ, if you were taking 12 extra weeks of accrued vacation, I don't know that is your job protected?
No, the FMLA applies for the first 12 weeks.
The first 12 weeks, so you can do what you want with your other benefits.
And you
Or,
might have an agreement with your employer that it is, your job is protected for 24 weeks, yeah, who knows, but it's not legal.
but I mean, the legal thing is you are now gonna get paid for the 12 weeks that your job is guaranteed.
Yes.
And I think Senator Kitchell said that this is either parent,
Yes,
and that they could divide it up. There may be cases where the mother is making a lot larger salary than the father, and maybe she wants to take a whole week off after giving birth. You know, and they do, my daughter was there, give birth in the morning and go back to the fields in Africa, but we haven't quite reached that standard. But if a mother did feel that she wanted or needed to go back, the father could take this leave, or they could split it up. It's really 12 weeks for whatever individual families and what they do with their employers, if there's a benefit. Also, they can adjust that, but this is, and one of the problems that Senator Kitchell was trying to deal with is that no matter what we do for CDC-FAP, child care centers don't take infants for the first 6 weeks. Maybe there's 1 or 2 exceptions, but the general rule is somebody's gotta be with that baby for 6 weeks. They can't go to child care. So this helps fill that gap and allows the parents to be home.
So we exchanged some emails that picked up this over the weekend, and I just want to clarify that. So right now, the language in the bill does not allow for concurrent receipt of both benefits, but sequentially is permitted, but then it's a job. My question is, let's say you have a family unit of 2 people, and one has a benefit from their employer, and the other one would like to take the $600. Can the family unit take the employer benefit, and then the other one take the $600 so that they are concurrently taking paid leave, one from an employer source and one from the state source, and both parents are home with the child?
as far as I know, that is allowed. We don't have a lawyer in the room, but I believe that's allowed.
That's my understanding.
Thank you.
And you had also asked.
Damien's there, we have a lawyer with us.
Can't hear him though.
You're not
There we go.
muted.
Hi,
There you go.
can you hear me now?
No,
Barely.
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 Barely. Okay.
Jill's up in here.
I'll come down to the room. I'll be there in a minute.
Okay. We're up as far as we can go, so it must be his mic.
I did see another question from Senator Chittenden regarding the modeling and whether we took into account the fact that some parents might take their own employer-provided benefit for 12 weeks and then tack on some extra weeks from this parental leave program. The answer is yes, we took that into account already, so you won't see that number go down further. We're modeling an 8-week average duration for this leave. You would think that if a family doesn't have any other leave, they might take the full 12 weeks. If they have 12 weeks of fully paid leave from their employer, or close to fully paid leave, they might take maybe 6 more weeks, or maybe 4 more weeks, or something like this. So we tried to think of a reasonable duration for this leave.
And one of the issues Senator Kitchell has had with other systems have been payroll tax and have been based on a percentage of your income. I think it's 2/3, which is what unemployment was or is. But for lower income people who are having a hard time making ends meet, to live on 2/3, so they're being taxed, but they just financially can't. So this, for the lower income, you are making at least your salary. So you'll be fully funded, and then as you go up, you get, it's a smaller and smaller portion of your salary. But it will help out those folks that get disadvantaged really by more traditional systems.
And I should add, the $600 does decline as income goes up, so it doesn't stay at $600, it declines.
Yeah.
Higher incomes. One question in my mind is whether the reimbursement rate should stay at 100% of a person's wage down at the low end, because of course, if you're not working, if you're not receiving wages, you would not be paying the payroll tax, the Social Security and Medicare payroll tax, which is 7.45% of your salary. So many states choose to reimburse at 90% in recognition of that. Something to consider.
Okay.
Just the lower end, we go to.
So only the lower end is guaranteed as much as you're earning per week.
You
Once you
can't
reach
learn more
$600,
than your,
You're proposing other states have it at 90%.
90% of your actual wage.
which recognizes that we won't be collecting that 10%. Yes, Damien.
Do you have offhand what the approximate saving difference in total cost that might be going from the 100% to the 90%?
Well, so I would imagine that we would do 90% of wages as far as it goes. So it's going to go farther than the $600, 100% of wages, right? So we'd have to model it out further up the scale and then drop it down.
Is that something you could do?
Yes.
Okay. Like in the next 24 hours. But this is going to approach.
Yes, yes.
And I believe this is going to be paid out of present funds, a lot of it from, well, we'll wait till we get to the financing section, but I think a lot of it is withdrawing the present child tax credit, which is almost $32 million. And use that as a way to help fund these people, because that really was a prime motivator in the tax credit. Okay.
I would also add that there are administrative costs listed on your one-page sheet. We need to give more administrative funds to CBB in order to administer the CCFAP expansion. We also need to give them, or AHS, some money to administer the parental leave, and they might choose to use a third party to administer that parental leave program. So on your one pager, you'll see that those.
And we will get to that. I think Damien is here. And I don't even remember the question we had for Damien.
So there were, do you want me to take the chair and then I'll?
We probably can hear you better.
Okay. So there were a couple of questions that came up. The first was whether, and there was some discussion first about whether parents could split the leaves between themselves. The bill does not allow for that currently. It says one parent per household may take the leave, and it has to be taken as a continuous block in the current bill. So that can of course change, but the current draft that came out of Health and Welfare provides that only one eligible parent in a two-parent household shall apply for and receive the benefits. And then the benefits are calculated in increments of one full day at a time, but they have to be taken in a continuous period of up to 12 weeks.
Okay.
So, and that period has to fall within 1 year after the date of birth or adoption. The next question was, is there anything that prevents a family from having one parent take employer-provided leave while the other parent is taking state benefits, nothing. So that is totally permissible. Parents can figure out what works best for them. If that means both parents are off at the same time, one taking employer-provided benefits, the other using the state program benefits, they can do that. If it works for a family to, for example, have the birth parent take the 12 weeks of the state program and the non-birth parent, say, take a couple of weeks off following the birth to help out, and then at the end of the other parent's leave, take off another 2 or 4 weeks, whatever it is, that's also permissible.
A question that came up actually, I think in one of the discussions about financing was, what if a parent didn't feel they could take 12 weeks off because of the job demands, or because given today's remote work environment, could they in fact go back and work 1 or 2 days a week, but not go back full time, which is, again, I think it comes down to nothing, not philosophical, but basically what we can finance and manage.
So and I'll go into this when I do the walkthrough, but currently the language provides, so actually, let me just share the screen to the language. Currently, the language provides that it is an eligible parent who is caring for the child and unable to work. So if you are working, you are not collecting the state benefit. If you are unable to work or off from work because you're devoting your time fully or substantially fully to caring for the
I
child.
don't like that word, unable. I'm surprised the feminists haven't gone berserk.
So we typically use that for time you're out of work for whatever reason, including under our existing job protected leave statute.
Says unable. All right.
Yep. So the idea is that so even if you're caring for a family member, whether it's following the birth of a child or not, it's not that you physically are unable to work, it's that you're devoting substantially your full working time to the care of that family member or that new child.
And actually for 6 weeks, you can't get childcare anyway, so.
Right. So the way this is set up currently, and again, this can always be amended, is that one parent can take the benefit at any time within that first year. It has to be in a solid block. The prior section provides that the job protected leave law allows the employee at their option to use any accrued paid leave, or in lieu of using accrued paid leave, use up to 12 weeks of the parental leave benefits provided, but that they may be used sequentially and not concurrently. So this would prevent you from using the state paid benefits at the same time you're, say, taking vacation or sick time from your employer. Right. We've had a variety of ways over the now 8 years I think I've been working on this issue in the State House of addressing this. Some of them have said the state program eligibility is limited, or you're not eligible if you're going to go over what you earned prior to the leave. Others have just said something like this, where it's one or the other, but not both. So.
I feel like I'm dabbling into the policy area, but I think it's still germane. But do you know if Senator Kitchell, as the presenter of this amendment, or the committee of jurisdiction, did they contemplate the allowing for the 12 weeks to be split so that in the family unit of 2, one could take the 6 weeks and then the other could take the 6 weeks at a different time, either immediately after the other? Or did they consciously consider what you proposed and said, no, we don't want that? Or is it something worth further accepting? Like, to give flexibility to families, I just think of 2-person families where their work schedules and life schedules might benefit from segmenting these.
I don't know if that was contemplated. I see Joyce is raising her hand, so she may know. We were involved in different aspects of
There's
figuring
a
this
lot of
out.
people contemplating on this bill.
Right, so the original idea was to keep this program very simple in order to minimize the administrative headaches. So that was the reason for limiting it to one parent.
Which I think is why you have trouble with just going back to work 2 days a week or, because this is going to be administered by DCF. And I don't think it adds any significant staff. So the more complex it is, the more money we're gonna have to raise.
Yeah, if you do something like partial wage replacement, so intermittent leave, what ends up happening is that, so for unemployment insurance now, you need like a weekly report so that you can figure out which days the intermittent leave benefits can be provided for. With unemployment insurance, it's partial unemployment, roughly the same concept, but in this case, it might even be more complicated because you're calculating in full day increments. So you have to show I earned income on Monday and Tuesday, but not Wednesday and Thursday, and I worked a half day Friday, so I guess that means I can't get benefits that day. So you do get into that sort of juggling with this, but
Yeah, I believe my family in Canada told me their family leave was administered as part of the unemployment system. That you were not able to work because you were home with a child, but DCF, I don't think is set up to do this. Unemployment with their present computer system, I doubt that they're ready to take it on either, but that's the system that works like this.
yeah, the states that have done this through an unemployment system either started a long time ago when it was a lot simpler and then have grown their system around it, or they're like Washington State and recently overhauled their unemployment system and then invested an enormous amount of money in a new IT system that could marry to the unemployment system, because you can't use the federally funded unemployment administration to administer a state program, but they can talk to each other. So they essentially have two platinum level computer IT systems that run in parallel and are extremely sophisticated, and they're very happy with them. But the price tag was extremely high.
Okay.
Did you show us the language where is it a permission to seek a third-party contract?
There's no language around a third-party contract
Okay.
in here. There's nothing in here that prevents it.
Okay.
And I don't know off the top of my head what sort of authority the DCF commissioner is granted under statute. So they may already have contracting authority. I know it varies with these things. With larger programs where we're doing insurance programs, a lot of times we've provided the authority expressly, but sometimes in the general grant for a department that runs public assistance programs, you may have provided that authority already. And I just don't know. I can check with Katie to get you an answer on that.
I mean, that way, under normal circumstances, I think it would be Senate Economic Development's jurisdiction, like how we contract for this if we do go outside of the state. But those are not the circumstances we're in, but I would like to better, this is one line here that says administrative resources needed, allow third-party contract. I don't know where that's gonna, like, is that gonna be resolved somehow?
But this is, I think, going back to a PROPS for their lining it up. Anyone else that's been involved in this discussion? I think it's just been realized that there would be some cost to this, to administer it. Okay, let's see if we can find out.
We've done this before though, where we've given them money for contracting without having to go to economic other committees. It's just sort of part of the administrative fee or
Yeah.
administrative costs that we assume. So, and it's not something we haven't done before.
I guess when I feel like when the recent examples, like I think that we were trying to stand up a permanent program in the future. It was like hazard pay or things like that, so I would just be curious, if you're standing up a new paid family leave program, that can be a foundation for future
Sure.
work. It does feel consequential unless we're trying to just do this as a very temporary patch, but
That's above my pay grade.
yeah.
I think they're thinking that this is not a program, but a benefit. And it is a simple benefit that we will give you, and it's just
Right.
getting the applications and sending out the checks. Again, the more we embroider, the more
Yeah.
we increase the.
Well, that's why I might not,
Yeah.
we might not want to allow a third party contract, I guess.
Well, I think we will be hearing, have Senator Kitchell come over and talk to us, which may be first thing tomorrow.
No, and we can provide express authority with things like hazard pay. We did provide express authority. And those cases, we also provided a waiver to state contracting requirements and let it proceed under the, I forget exactly what the phrase is, but basically allowed them to waive the open bid requirements so that they could do a sole source contract. That was because of the urgency of the pandemic and the timelines we were running on. Here, you might want to, it's worth noting that anytime you're doing procurement contracts, you're adding to your setup timeline just for contracting. That can add a significant amount of time. And I can't speak for DCF as to what their administrative resources are or where they can fit this in or not at this point. I can just speak to
Well, we'll
language.
ask Senator Kitchell to come in and talk to us about that, or whoever she designates. Okay. Anything else, Damien?
No, I think I'll step aside till it's time to walk
Okay.
through some of the new language with Abby.
That Abby's got, okay. Emily Byrne, I gotta go back, I've got David way down on the list, 'cause and Emily's name is up there. Emily, are you here?
I'm here.
Oh, you're
I'm
right
hiding behind you,
behind me.
sorry.
Okay, I'm looking at your name. I get nervous when you're not here.
Well, I will not be here. I will be taking
Yes. you
plenty
will.
of time.
With or without this bill, you will not be here. Whether or not you're here at this
I'm here
minute.
today. Gone maybe tomorrow, maybe not.
So let's get everything you've got to give us today.
All right, let me figure out how Zoom works again. I'm gonna try to share my screen.
At that time, a quick question to Amy. May I ask a quick?
Yes.
So does the 12 weeks, does it have to be associated or start tied to when the baby comes, or can it be 12 weeks later on, whatever? Does it have to be associated? or-
It's anytime within a year after the birth or adoption. So this, for example, say parent one gets, let's say they have a really generous employer and they get 20 weeks. They take their 20 weeks, then parent two takes 12 weeks after that, and then they start childcare. That's conceivable.
I think the question that came up was you have a difficult pregnancy and you are required bed rest for a week or two before the birth. This would cover that, right?
This does not cover that as currently written. So as currently written, it is leave from the birth to 1 year out. You would, an individual who had a medical condition that necessitated that they stop working before birth would need to use some other form of leave. They could take job protected time off then, but they'd have to use some other form of wage replacement. So-
But it says can start within 30 days of due date, which I confused me because I thought that meant 30 days before your due date.
Just took a,
Two sides.
I think that's, I mean, if we're only paying for 12 weeks, I don't know.
so
You might not want to say that because that's what I looked at it and thought, okay. So
This is a work in progress, and what,
Then you don't have to have the word date, you say first.
okay, so we will check on that. Okay, so.
So Emily
Where's
Burton,
Emily?
Emily Burton from the Joint Fiscal Office. I believe on the website, there is this sort of side-by-side, it's under Joyce's name, I think. But I will, at a high level, sort of use this to frame the conversation about where the money should come from to support the bill. So at that top,
Yeah, there's a side by side, you have it on your desk.
yeah, the top part of the box goes through what the estimated costs are anticipated to be based on what appropriations is planning to do. So including those readiness grants, the eligibility expansion we've talked about, the parental leave benefit, and some of the administrative costs at DCF that we were just discussing to cover this new program. The sort of first source of funds that would be used to cover these expenses is the $49 million that's currently in the governor's recommended budget. So redeploy what he's put forward for the CCTAP increases into covering the cost of this program. So that drops the new funding needed in FY24 and FY25 to $34.9 million in 24 and $111.4 in 2025. What we've been asked to model and put forward are the sort of options to fund below that. So to sort of fill in those numbers, the first source of funding that can go into effect into FY24 and then carry forward into FY25 is the repeal of the child tax credit that was passed last year. That was about $31.8 million is what's assumed in the FY24 and the FY25 budget. So if you recall, this was in Act 138. Provides a refundable tax credit of $1,000 for every child aged 5 and under for qualifying taxpayers. So, and if you qualify for it, regardless of your filing status, if your AGI from $0 to $125,000, and then begins to phase out up to $175,000.
And that was our effort last year to help pay for the cost of childcare.
Yeah.
Was the thought.
So
We had a
I
question.
should know this, but was that the only year Vermont has ever done this? And we kind of did it because we had, okay.
Yeah.
Because of the pandemic and kids.
Yeah, and this, so as it would go forward if it's not repealed, but
But
it has
that's not
only,
really used to it.
Yeah, right. That's what I was-
yes, it's only been in effect for tax year 2022. So this would be repealed for tax year 2023. It will, it was a big adjustment in terms of tax liability for folks who will qualify for it. They had a big drop in their liability. It will go back up as a result.
So since we're the TAC committee, and this isn't very relevant, does this go from age 0 to 18 or is it to 13?
0 to 5.
0 to 5. Thank you.
Yeah.
It was a childcare.
Thanks.
Yeah, so just to, because we are the tax committee, we'd be repealing a tax credit people were already in that fiscal year that they'd be looking at.
It would be repealed so right now,
From January through next year.
next year.
So this calendar year.
Yeah, but they will, the only year they've been eligible for was last year. They're filing those taxes. They'll get the rebate this year. Next year, they won't get the rebate. They will, if their kids are in CCFAP, will get an enhanced child care benefit. The ones that might hurt are the ones children that don't send them to childcare.
Right. Yeah. And it takes an active repeal of something that otherwise would have been.
And there is a draft amendment
Okay.
sitting on my desk.
I'm not saying it doesn't make sense. I just want to make sure I understand.
Yeah.
It's like it takes a proactive step to
Yes.
repeal it.
Yes,
Yeah.
we have to take responsibility
Yes.
for what we do.
And I think to Senator Cummings' point, not everybody is necessarily using this $1,000 for childcare. They may, if they are qualifying for fully subsidized childcare at this point. The benefit really comes through the paid family leave that becomes available, and they're sort of, the impact is going to vary depending on people's income.
The lower income people, we did up the earned income tax credit a lot last year. We upped the child and dependent care tax, the state rebate on that. So there are other benefits that families receive.
And what was the age range for your child to receive the tax credit?
0 to 5. So it was $1,000 per child.
Okay.
Up to 125 AGI, phased out to 175. So that was the sort of first piece that could go into effect right away, and that general fund could drop to the bottom line in FY 2024. So that's about $31.8 million estimated. In addition to that, we were asked to look at what the implementation of an employer-based payroll tax would be. So this would be a payroll tax that employers would pay on the wage base that they currently have up to, I'm gonna look to Joyce to make sure I get it right, 100% of the I'm gonna get it wrong. I told you I was gonna get this wrong. The Social Security wage base.
Right, Social Security stops being deducted at a certain wage level.
Yes. So up to that point, wages up to that point would be subject to a payroll tax. So part of the things that have to get, if that is the funding mechanism that the committee chooses to move forward with, there are a few costs that would be incurred in FY 2024 as a result of that, mostly the administration of the Department of Taxes. They would be setting up an entire new tax type, which would require IT and positions, et cetera. I'll let the Commissioner of Taxes go into that, but what we've been sort of using in our modeling is the assumption, which was in H66, which is the paid family leave bill that was passed by the House, that it was about a $6.5 million startup cost in the first year. If we take all of that into account in the first year, we need $34 million based on this new funding construct, less the child tax credit, plus the tax department administration, leaves about $10 million for the appropriations committee to find in the FY24 base budget. And then if we move on to 2025, so we need about $111.4 million. You continue forward with the repeal of the child tax credit and implement the payroll, the payroll tax, which my understanding is the tax department could have up and ready to go July 1 of 2024. We have modeled that if you do the child tax credit and an employer-based payroll tax, it's about 4.7%. I'm sorry.
0.47.
I knew I was going to do that too.
I was gonna say,
0 point.
I think Megan Sullivan just
I knew I was going to do that. 0.47% payroll tax. There would be ongoing administrative costs at the Department of Taxes. Again, we've used the sort of what was put forward in H66 for tax department needs, which is about $2.3 million. And we would also need to fund the state employee contribution of the payroll tax, which we estimate to be about $1 million at that 0.47% rate. If there was a decision made not to repeal the child tax credit and to only fund this with an employer-based payroll tax, you'd have to figure out what to do in FY24 to fund those sort of startup costs to get the program going in January. for the payroll tax would be about 0.64 without the child tax credit. To cover all those things. So that's what we've been asked to model at this point to cover this new program. I don't know if there are other questions on that or.
You have nothing I told you to, but on the 14.2 million for the parental leave benefit, this came up with somebody else speaking previously. If that was at 90% rather than 100%, would that be simply 90% of that?
No.
No.
No. It would be 90% at the very lowest ends of the income distribution, right? But then the $600 falls down, so it's going to be less than 90%.
Are you paying payroll taxes on this benefit?
No.
No. So 90, well, we only gave you 90% of your wages. If you're at the higher income, you pay less. And you be paid, we're losing more because you're at a higher income. Of course, if you aren't collecting wages, then we wouldn't be collecting anything, right? If you just took the time off, if I have a paid family leave from my employer, I get, those are wages, right?
Yes.
Okay, so, but if I get the state benefit,
Not wages.
it is not wages.
But it is treated like unemployment insurance for purposes of taxation. So it's taxable income, it's just not wages. So you get a
Okay,
1099-G at the end of the year for those benefits, same as you would if you got unemployment for 12 weeks.
Okay. So that we aren't. Can somebody figure out how much we might lose, if anything?
If it went to 90%?
No, if people are getting paid family leave from their employer, that's wages. They're paying it. If they take the benefit from the state, that's not wages. So we are losing the money we'd make if they took. No,
No, because it's still
because they don't get
taxable.
paid it.
It's still taxable income, and presumably, so employers may change their behavior
Yes.
if they don't, if there's a state benefit that's close to what they're
Quite
offering,
likely some of them will.
right? For higher income individuals, they're unlikely to take the state benefit as their primary wage replacement. They may take it to bridge from when their paid leave runs out to the end of their leave. But it's hard to say. I mean, I'm not the economist in the room to be able to tell how it's going to affect, but it is still taxable income. And so you are going to be still collecting taxes on it.
You're gonna get paid on what,
It's
or what you get paid.
right. So you could be taxed on up to $600 a week of income. It's not subject to FICA, which is the payroll tax,
Right.
whereas your employer's wages would be subject to FICA. And that's really where the 90% comes in.
Okay.
So FICA is 7.65% for the employee. So it's a little bit less than what you would get if you take FICA off the top of the employee's wages. And then you'll still be, depending on where your income comes out at the end of the year, you'll still be subject to the state income tax.
Okay.
Am I missing anything, Abby? I'm looking to Abby to make sure I'm not misspeaking, since she's the tax attorney in the room. Yeah.
All right. It sounds like for the money we might or might not gain, it would add a great deal of complexity to the system. Right? Now, if we only paid 90%, but that would to me, that would defeat one of the purposes of, if one of the reasons if a person making minimum wage or thereabouts can't afford to take partial payment, because, so if we're gonna give them a benefit, which is partial payment, are we hitting them? I'm looking at Joyce because she brought this up.
Right, so they would be missing 2.35%, right? The difference between what they would have gotten 100%
Yeah,
of their wages.
yeah.
But if they had been working, they would have paid 7.65% of that in their Social Security Medicare taxes, right? So they would actually be missing only 2.35%.
How about 95%? So we auction this. I mean, I know Senator Kitchell has strong feelings about enabling people at the lower income to be able to afford to take paid family leave. If you're at a higher level and you can hire a nanny and, you know, life is good, you have options. People at a lower level don't, so. Actually, give them a 7% bonus, okay, but we would lose. But we are going to have to pay the payroll taxes at the state.
Yes.
Okay.
A couple questions. I mean, I guess what's hidden in here or is hard to kind of spell out explicitly is that we are also achieving some savings on the childcare side by having paid family leave. So I don't know if it's like winning or losing, you know, where we are having to raise less, knowing that at least 6 of those weeks would be more expensive on the childcare side if that person was gonna put them in childcare, which obviously there's question marks there, but somewhere in here is buried the assumption that there'll be potentially a significant number of people who take a lower cost option than childcare. And then my question overall on this so far is, what should we understand about a payroll tax if we move ahead with that option? That it's could be volatile, that if we have a lot of open jobs or unemployment, we make less. Like what are our pros and cons to it?
And I know Emily's that you or Joyce. I know there was a temporary panic last week when somebody told Senator Kitchell that the payroll tax only increased 1% a year, and there was a lot, but that wasn't correct, so.
No, over long periods of time, wages generally rise 1% faster than inflation. So the real rate of growth of wages over time is about 1% per year.
Of inflation.
Above inflation,
Right. Which allowed some of us to take a very deep breath. That's why we were late for caucus last week. Deep breath. And so there is a natural increase. If we have another great recession, I don't know, everybody will probably share in the cuts. I don't know how we do this, except there is some discussion about setting up a fund. We have to do that anyway, right?
Yes.
Special fund.
Yeah.
Because we're gonna start in the middle of a tax year and we're not gonna, so we need to have some place to park.
So I believe the intent is that the payroll tax itself would go into a special fund and that DCF would be directed to spend the general, they currently have a general fund appropriation for CCFAP, be directed to spend their general fund first and then utilize the balance in the special fund to cover whatever that.
So we are not going to be using this as a way to relieve DCF of its present obligation, right? So they have to pay what they're paying now per child if we get new children in, or just the base appropriation.
They will just have a sort of order of operations of which which appropriation to spend down
Okay.
first. So the rate will go up, theoretically, the number of kids that are enrolled will go up, the number of people eligible will go up, the paid family leave program will go into place, the grants will go into place, they'll spend down their general fund and then shift over to the special fund
Okay.
to cover the balance.
Committee. Questions? All right.
I mean, I have this nagging feeling like I know we could just watch the rates into the future, but that's where our payroll tax ties us, then it just feels like if a center accepts this major subsidy, this state funding, things could start to get really off track when, if they keep increasing their costs much higher than inflation, while the payroll tax will really only cover 1% above inflation. And that parents are gonna have to make up the difference, and we're no longer able to guarantee that they're paying 10 to 15% of their income. So it's struggling with something.
So I'm not understanding the question. So right now, the CCF reimbursement rates would rise by the wage growth in the educational services sector in Vermont. So how that goes off the rails, I don't understand.
From what we can commit to with a payroll tax.
I don't understand that. So the payroll tax is growing with wages, and the CCFAP reimbursement would be growing with wages.
But then the cost of childcare might not be growing with the same rate.
Then we'd be in the pickle we are in now, right? Where the cost is too high for families to bear. And the childcare centers make that decision about whether they keep wages low, which reduces the supply, or whether they raise the price in order to attract the workforce to serve the demand that they see.
Or then we're not kind of able to maintain our commitment with the money that we spent to keep this as a certain percentage of people's income.
So I'm not sure I
I
understand
don't
that.
think we made a commitment to keep it at, I think your concern is that because we're giving people a subsidy, and maybe in places like Chittenden County where the bulk of your kids are presently not on subsidy, so a few kids that are, now you'll pick up a bunch more because we're raising who is eligible. That they will, well, the state's putting money into this, therefore parents pay the same amount. We could make more money, and so we'll raise the rates that offset CFAP. And I think what I heard was that could happen, but there is a market out there. That parents don't have to go to that center. That especially in populated areas, there are other choices, and that if enough parents are moving, then that center will either have to bring its rates. There's a competition in rates, and maybe it's a lot better, and some parents are willing to pay a lot more to get a lot better center. But there's going to be parents that can't. And I think the hope is we are bringing our reimbursement up to a level that allows the center to open, provide a quality program, pay their people decent wages. If all centers, and centers can't talk about what their rates are, it's got some federal thing. It's where the child care workers couldn't organize. Unless there's collusion amongst the centers, some centers can stay at the present rate or only go up, slightly, but we're gonna go up. But there'd be a market force. You don't have to stay at that one center that's put its rates through the roof. Otherwise, we're at the mercy, if we just say we're gonna keep going up, do we want to tell people that they can't raise their rates because that's where we got before, our rates are inadequate, and so they can't I don't know.
Two things come to mind. I think of the education funding formula where we have a penalty, a spending penalty when the per pupil rate is a certain amount and the communities get hit. And I also think of like the Cadillac tax for the healthcare at the federal level. And I'm wondering if there's something here to consider that if a childcare facility, I don't know how we would structure this in the law, but just sets their childcare rates at too high of a level, we should not penalize, but we should claw back or reduce the amount of subsidy in order to try to only reward those that are sensibly pricing it, to have some of the control, I think, Senator Hinsdale is speaking to.
But who would you penalize? The center or the parents?
Yeah, that's the question.
I mean, the parents that are getting the subsidy, if you pull the subsidy back from them, then they have to pay more, or they have to take their kids out of the center. Unless there's a whole lineup of people willing to come in and pay that rate, then we're not hurting the centers at all.
You know, we're sort of trusting market forces to free up, and then there'll be competition, which will keep rates relatively reasonable.
We're hoping.
On that point, can I clarify, where do these monies go? Some of this money goes to the center, those base amounts, and then the subsidy comes back to the parents and the tax credits when they do that? No, okay.
No, goes
Right
right,
directly to the
All of
provider.
it to the provider.
Yeah. and then the parent subsidy, the parent owes the provider.
So if it's all going all to the provider, I see, to Senator Hinsdale's point, if there's a mechanism that we have them attest to this certain rate and that they tell us what their rates are, I mean, he's pretty good at keeping secrets. We can have penalties if those rates exceed certain amounts.
And what if, I don't know, maybe I've been here too long, but the minute we start trying to micromanage, it gets very complex. I think we all have to admit, even in trying to do well, when we put in the STARS program, we put a whole lot of home-based people that were providing perfectly good childcare out of business. I mean, we had one woman that probably raised a third of the kids in this town, but she was 50 years old and she wasn't going back to college. And it was a good thing. But we're making a major step. We can always, if we find that we've got price gougers out there, we can always come in and deal with it. But or we can come up with a couple $million more and set up a department to manage it, which I think is what's in the bill that is not going to be in the bill when it comes out of appropriations. Because it's a very complicated thing to restructure. We can still do that in the future. But right now, we're just trying to get money out the door.
I have never seen government outthink the private sector. So I would be really cautious about trying to build a provision that anticipated those responses and then adjust it.
To that point, Senator Hinsdale and I have constituents in our inboxes right now facing huge increases. in 40% increases. And I'm just worried that if we funnel more money into these centers, if it's not also tied with some. But I agree, we can always revisit this next year, see how it materializes.
They may be doing that 40% because that's what they need to hire staff, which is the big reason they aren't opening or expanding. And that may well be, we may well have to look at the numbers again next year because that may be what it costs to hire staff. And it probably costs more in Chittenden County where you've got almost no unemployment and higher wages. So, yeah.
We've talked in the past, I think, done things where we tried to bring money directly to the employees of such places. You know, you might say, oh, steering the money to wages over, but I'm not sure how, even as I say it out loud, I'm skeptical.
I mean, I would just say, we have this conversation with colleges too. It's different than K through 12 where we have voting and mechanisms and it's generally public institutions we're sending our money to. There's a lot of private actors that we're giving a lot of money to and hoping that it all works out, just with a tax that is, doesn't have a huge upward trajectory. It would if we fill all of the 24,000 open jobs we have in the state potentially, but it doesn't grow very fast as a tax, and it has the potential to become unstable.
There aren't many taxes that don't, except property. We don't like them. Taxes rise and fall with the economy, and if the bank crisis doesn't get fixed and everything crashes and burns, we're gonna be dealing with another whole thing, and we'll do what we always do, which is our best. You can't. Right now, this is a huge step forward. And this is putting, $100 million in new funding in. That's a lot of money. And hopefully it will help a lot more parents be able to afford to go to work, or they can afford their financial if they're only losing $10 a week by not working, as well not work.
Do we track right now, every childcare center that we give money to, how much their rate increases are every year?
Yes, it's out. They were here, they're gone.
How would we know I think you all would be
We
mad
have
if
to
Cheney
ask-
County said, we're expensive, so we're gonna increase our rates 10% a year, and then, that didn't happen in the rest of the state in the next few
Maybe,
years.
well, I think that would be a question for DCF. They're the ones that administer the present program. Joyce, do you know?
So my understanding is that every 3 years, they do a market survey in order to set the new CCFAP reimbursement rates. And they ask for the market rate, right? Like, what price are you charging for infants, toddlers, pre-K? So already they're checking in every 3 years. I know that as part of the bill that's passed by Health and Welfare, there was some annual reporting back on what they did with the increased reimbursement rates from CCFAP. And perhaps, yeah, I think that was in there.
So can you show me the last market rate?
That's
By county.
exactly what you saw in my presentation.
Is it broken out by county?
No, absolutely not. It's statewide. I don't know.
It's an average that, yeah,
So the rates that you see on that chart that had the centers on the left and the homes on the right, that's the 75th percentile of the market rates. So
But
you get,
there's no way to break it out further than
I
the
don't know.
statewide market rate.
I don't know.
Okay, that's what I'm
It's a
asking.
CDD question.
Okay.
So just on that point, rent is more expensive in Chittenden County.
Yes.
I would get very much say with childcare is more expensive in Chittenden County, so it makes sense.
their wages are high.
But for those that aren't making those wages, they're still having to find that childcare. I don't have-
And if there's enough of them, the theory is now that we're paying a rate that is equitable, that they can afford to open a center and we don't know that, but the theory is, right now, if you're living with 90% of your kids are on the state rate, you can't survive financially unless you're not in this to make any money. If we raise the rate to the market, then in theory, if there's people that can't afford the high rates, you maybe rather than a 5-star, you'll get a no star or 2-star that will open up. And, but we won't know that until we get into it. So, but maybe that's where we put a check back. My betting would be that rates are starting to go up in Franklin County because you got more people moving there so it's supply and demand. But we haven't been making it possible to open a lower cost place with a large number of your kids depending on state aid. Now you're gonna have more, if more of your people in Chittenden County are getting help from the state, they might be able to afford that 40%. Because up to that 600%, they're going to be getting some assistance. And we won't know till we know, but a lot more people are getting state aid. There's a lot more money going into the centers, and so they might not have to rate their raises.
I really want to belabor the point, but I just, as much as wages are higher in Chittenden County, the minimum wage is the same for everybody. So
Right.
at the lower end, those individuals have to find childcare. In Chittenden
Yes.
County, it's gonna be more expensive, so that's why it seems to make sense to me.
Well, but this way, somebody could afford to open
I
a
do.
center with a large percentage of lower income kids or parents. Because the center will be getting paid a rate that allows them to operate and pay their staff. And the chances are we're gonna end up going up in that rate.
The higher wages, because they're
Well,
Chittenden
that's
County.
why we're raising the rate, because.
I drink too much coffee, so I'm gonna.
Well, I think one fundamental question in demographics, that you raise the rate, kinds of rates that we talk about here, whether or not you'll be able to attract the rate force that you need and the quantities that you need to meet the market need, I think is a real question. We know right now in the public school system that has these rates, there's significant difficulties in filling openings. And I would expect you're gonna see the same thing here.
Yeah.
So
it's-
that's one thing that makes me very skeptical about the kinds of rates we're talking about as a solution to the problem, because the problem is bigger than that.
And it's got to do with housing, and it's got to do with jobs, and yeah.
So you look at the numbers that we need, the, in effect, compressed time frame that we have to do them, particularly as far as housing is concerned. The question is whether we've got numbers and we've got increased rates that we're paying for all of these things, and whether or not they're sufficient to do what we need to do, sufficiently motivating, particularly as far as a labor force that doesn't seem to exist entirely. It's not a case of paying people more because they're leaving those jobs to take other jobs when there are vacancies in those other jobs as well, even when they move. So it's a larger
It's
question.
a bigger question, but I think this is our effort to help, because part of the problem we heard is if there's no childcare, then even people that want to work at whatever wages can't work. And so, or can't have children, and we need children too in this state, we're aging. And some counties are grayer than other counties. I mean, they're not gonna, so I don't know. I had Senator Gray and then Senator McCormick, and it may just be because my eyes follow that direction. I saw that over there.
Yeah, I'm just wondering if we're heading in the same direction that we've gotten into trouble managing healthcare. We don't have a competitive public healthcare system. We keep pushing money towards healthcare in this place. And I can also imagine, not making a case necessarily for like birth to 16 public care or public education and childcare. But it does work, and we're trying to influence the market this way, and I have a feeling that we may end up funding things more and more over time, but we won't have the control that we might want in order to manage that system. Outcomes that we're basically making it more affordable for the pandemic.
And this isn't just Walmart, this is everybody. I mean, basically, an awful lot of our present system is built on the assumption that mothers were home. Mothers aren't home from June through September. Mothers aren't home a week in February. And the after school, the cannabis money is dedicated to after school programs, but that's all childcare. It's all part of, in this new world where both adults in a family or all adults in a family need to work. What do we do with kids? And we need kids. So we're trying to figure that out. And the countries that have set up a system, for better or for worse, are paying 50% of their income in taxes, and that's not acceptable in this country. So we're doing the best we can.
Yes, I mean, I'm not complaining, I'm just sort of having.
No, I think,
Eerie
yeah.
sense, eerie sense of the road we're going down.
Yeah, I mean, I can remember talking about, well, if we don't put, reins on hospitals, they'll just build these giant pleasure palaces with all these amenities. And now, that was a word that was used in here. And now suddenly, we don't have enough rooms, and we don't have enough nurses, and we don't, so it's putting the reins, but then letting them up, and it's hard to know how to do that, especially when there's 7 of us sitting around this table making decisions. If I talk, so you talk. Sandra, go ahead.
Getting back to Senator Rahm Hinsdale's concern, I wonder if a remedy is all that complicated. As trustees of the public's money, which we're doling out, I think we have a duty and we have a prerogative to put conditions on that money. It's not free money, it's the public's money. It's being given out for a particular purpose. How complicated would it be to simply say, you get this money on condition that in price increases be no greater than the rate of inflation?
We do that all the time, Madam Chair. And then the next legislature, goes, well, what's a nice recommendation? We do, yeah, well, please.
I mean, we can do that. What tends to happen, I don't know, we can do it.
Free money is very inviting. But this is not free money. This is saying we're operating on the assumption that the childcare facilities are charging what they need to make the operation run.
Well, these are not for-profit business. I mean, these are for-profit businesses in many instances. We haven't gotten to where we need to get to, which is how are we going to raise about $100 million, which the only easy thing that's come up is a tax on employers, or we could do a tax on employees. But these are for-profit centers. Are we going to say you can't make a profit and not, or start dictating what a reasonable profit is?
No, we would just say what the conditions are of the money with which we have been entrusted that isn't our money.
Okay, so
and we're giving it to them, that these are the conditions for getting it.
We're giving it per child. What if we say, okay, you're raising your rates more than we think you should. We're not giving you, which means we're not giving the kids in your center that. And they're saying, tough, I'm not, then fine, they can all go. It's all 5 of them. What happens to those 5 kids?
But it's not us telling a company, this is how we think you should be running your company. That's not what we're saying. We would be saying, if we put the condition on, what we'd be saying is, if you want the taxpayers' money, these are the conditions to get it.
But what inflation rate?
I'm sure that the bill says that the commissioner will set the rates.
Yeah.
And
based on
but
wage
we
inflation.
won't let that happen. The commissioner will make recommendations, and the appropriations committee will make a recommendation on what the rates are to be, and we'll set it. Same with the tax rate for schools. You have a December 1st prediction of what it would be if they change it, and it gets made here because.
And it'll depend on the economy and how much we think we can raise and how much we can't. Right now, we're doing the best we can, but I'm not, especially in areas where there's a lot of wealthy people, that can perhaps be willing or afford to pay for better, I assume it's better because it's more expensive childcare, or it costs more. That to say, okay, if your wages, if you raise yours more than the inflation rate, and it's the increase is set to wage inflation in the state, right? Or
Yes.
in education.
Yes.
So if you raise yours more than the teachers are getting, then we're not gonna give you any more money. Some of those parents can afford to make up the difference. The lower the income the parent, that parent is gonna be up the creek if they don't have the money. They could do it with the state subsidy, but once that state subsidy goes away, and we're doing a lot of assumptions here. We're gonna look at this every single year, and if we have some bad actors,
Okay, again, I'm thinking all conjecturally here, but wherever we peg, whatever we peg as the standard, you're getting the taxpayers' money. You raise your rates however much you want, it's your business, it's up to you. When you raise beyond the criterion we've established, then that additional income is deducted from what we give you.
You change
Structure.
You change the rules, you have
there's the word.
put Clorox on the door handles twice a day instead of once a day, and the rates go up.
We've gotten in so much trouble. I see who wants to talk over here?
I would make two comments. The first is that if the CCFAP rate were close to the high quality rate that was recommended to us by the RAND report, I would worry that centers could charge anything above that and get away with it. However, we're not close to that high quality rate at all. We're still far below it. And so we're just trying to give a little bit of help to the childcare providers so that they can perhaps offer something closer, not at the market rate, but something closer to the market rate in wages. The second thing I would say is that if you talk to directors of childcare centers, they will tell you that they are constantly weighing the ability of the families to pay against their costs. And they would love to be able to charge more, but they can't because the families cannot afford to pay higher prices on average. They're looking at their clientele.
So you're saying that the situation, the problem I was just trying to solve, actually is not a problem, it doesn't exist.
I think we have a huge problem in that the centers are not able to pay comparable wages to other closely related professions. And so what I've heard from centers is that their folks are leaving to work at McDonald's because they can earn $17 at McDonald's and they're only getting $15.
Well, that's
Yes.
not the problem I was trying to solve the problem that the Senator Ron Bisdale raised, which is the possibility of, you didn't use the term of profiteering.
Yes.
That was-
If we saw centers profiteering, I would think they would be able to pay their workers enough to attract sufficient workforce to their business. But in fact, we're seeing they're not able to attract those workers.
Well, Emily Littell, never mind.
We are only paying 63% of what the estimate is, would need to be. And so we're helping. But I would ask the childcare centers that are looking for the 40%, I assume they've got a reason that they feel they need to do that. And if they're saying it's corporate profits, I think that their families might go looking. And if we help other centers make enough to take on those families, we'll help them, we'll give choice so they won't have a closed market.
We keep talking about wages, but for so many people, it's wages plus benefits that attracts them to a job. So how are we doing when we just have conversations about wages? What's going on with benefits that someone might get in a childcare center setting versus, moving to older kids and, you were teaching in school. Like, I don't know if there's benefits offered, some at all.
I think that's probably reflected in the price that they're charging. If they're paying for healthcare and other benefits, my understanding is in general, they don't.
So I don't know if I missed it somehow, but I just learned that there is a study in the bill that looks at a pay scale for employees and linking that to the program's ability to receive CCFAP payments. I might have missed.
That's the total cost of care study that,
So I can, we potentially end this conversation unless we're voting the bill out today. I'd be happy to look at that study for the issues raised here and see if we feel like that study needs to include more to address our concerns or give us back information for next year to look at this.
you can find that in section 6.
Okay.
Yeah, there are several studies.
Okay.
And
I don't like that big, looking at that study language either now or tomorrow. I am noting, I don't want to lose that 90% thread, because if we currently, as the bill is structured, that we don't pay for up to the $600, if somebody currently makes $450 a week, we reimburse them $450 a week. If I understand correctly, if we do the 100%, then they're this 7.85%, and effectively we're paying them more. It seems to track logically that if we did that in 92.15% or the 90%, it just seems to make sense. And I think you said many other states do that 90%. So I, as one member of this committee, would be interested to know how much lower that amount would be that we'd have to raise if we tracked what other states did for the same reasons the bill currently is structured to match what people make up until that $600 threshold. At the
I guess
90%.
my first question is, are other states doing this program?
So I'm thinking of paid family leave programs in other states where a reimbursement rate is sometimes 90%, sometimes 65% or 80%, but there are several states that use the 90% level.
Are they Louisiana?
I don't know
Texas?
I don't know what states they are. Damien, do you remember which states offer 90% reimbursement rates for paid family leave?
I think California just went up there.
Their average wage is $200 an hour.
Well, they had been at 65% reimbursement and they were finding that not enough people took up the benefit. So they just this year increased it to 90% in order to get more people on the program.
Give me 2 seconds, I'll get you the other states.
But it doesn't seem like 90% is really terrible, because they've already the 7.5% or 6.5%. It just seems like a reasonable thing to adjust the formula. Say, maybe, I don't know how much, $1 million?
Well, if I go back to my office, I can figure it out. Yes.
I'd like to know.
Try living on minimum wage. If I give them a $5 a week bonus, I'm not,
Well, with that logic, should we just have it $600 regardless of how much they make? Well, we currently
No,
have it
it's-
up to.
yeah,
what they
it's up
make.
to,
So
it's
this
up to your full
track with
wage.
that logic.
Yeah, it's up to your full wage. Yeah, the theory being that an awful lot of people can't live below their wage, so if we take it below, and I suppose we could say, well, it's your pay, is it your wage, your full wage, or your paycheck? I think that might.
Well, the idea is that they would have to pay income tax on the benefit eventually, right? So you don't want to reduce all the way down to their take-home wage.
Yeah, I mean, they're gonna pay taxes on this.
The wage replacement is does it contemplate if people have multiple jobs, a lot of people have more than one job to try to deal with the fact that they're not particularly well paid on their primary job.
Right, so that's part of the complexity that the tax department would have to figure out, right? How many jobs have they paid contributions on in order to figure out the reimbursement?
Quite common for me to have conversations with people, and eventually it comes out they have 2 jobs.
Yeah.
Or sometimes.
So.
Who drafted the study? Section 6, just
Section 6,
drafted.
Katie.
Katie did.
Katie, I think, is the main drafter on this one.
Yes.
Yeah, and she'll be back with us in about 35 or 40 minutes.
Okay.
I think she's off the meeting. Oh, she's still with us.
It's up on the screen, so.
Katie,
I don't have a question, I just wanted to make sure I knew who to talk to. So
Okay.
I can send you the language if you want.
that'd be great. I have lots of papers now.
Are you finished?
Mhm.
Okay. Any more questions for Emily? Next, I have Commissioner Bolio. Come on up.
Good afternoon. For the record, Craig Bolio, Tax Commissioner. As folks may be aware, I'm a tax guy, right? I'm not a child care policy guy. So I'm here to talk about the tax portion of the bill and the payroll tax. I am working from the draft March 20th, 7:55 PM, which I'm realizing may not be the most recent draft, but I think I kind of get the changes from that. So if there's one that I'm totally off base or
No,
not
and
totally resolved.
it's gonna change across the hall,
Yeah.
so all things are fluid.
So let me start with the headline, right? A lot of the things that the committee's been talking about today are things that the administration has been watching, right? Bank failures, economists worried about recession, people feeling inflation, record surpluses, right? Federal money. So as I'm sure you can understand, the governor is not supportive of a new payroll tax, certainly to the tune of 100+ million.
We haven't gotten it yet.
Fiscal office. Well, this draft has a payroll tax in it. Madam
Yes,
Chair.
it's either that or sugared beverages, but I think that'd be about a 50% tax.
Yeah, so certainly the governor's not supportive of that, right? And as we think about specifically, I appreciated your question earlier, Senator Ron Hinsdale, like what are the things to be thinking about with the payroll tax, right? One of them is what's the definition of wages, right? The federal FICA wage base is different than federal taxable wages, which is the wage base for Vermont state withholding. My read of this bill is that the wage base and definition is federal taxable wages. So that will line up for the tax department in terms of having the same definition of wages for our payroll withholding and a payroll tax. It will be a little bit different for businesses who are doing payroll taxes on FICA federally and on the state. I haven't had a lot of conversations with businesses to know what kind of inconveniences that places on them, if any. You got to answer who's responsible for it. My understanding of this bill is that it's all on the employer. Federal FICA taxes are split 50-50 between employer and employee. I am reading that the employer is also, is who we would collect from. So I think it leaves you with two things to think about there. Either you believe that the tax incidence of a payroll tax is, of an employer side payroll tax is not at all borne by the employee. If you believe that, what you're talking about here is about a 50% increase on business taxes in the state, right? Because corporate income for fiscal year 22 brought about $220 million. So if you add another 110 million, that's about a 50% increase. Or you believe that at least part of the tax incidence of an employer side payroll tax is borne by the employees, even though it's not directly held from wages. I would contend that the research, and I'm not an academic expert in this space, would say that at least some of this tax would be borne by employees and reduced wages. And I think that the Congressional Budget Office has some information on that. So in that case, what you're looking at here is the entire system funded by business taxes and wage earners. I think a big question that this bill appears to be silent on is self-employed individuals. On the federal side, right, you have to pay self-employment taxes if you're a business owner. This would essentially say that it's just wage earners that are in this system, not those who are self-employed. And that's, I don't know if that's intentional. That's interesting to me. Certainly, you're not going to deny those self-employed individuals childcare benefits. So they would essentially be getting the benefit without having to pay into the system, right? So I can imagine a partnership.
They have to pay FICA.
Yeah, but that's not funding this system at all.
Right, but if they have to pay a payroll tax or the they have to pay it. It's based on something. Mine was based on my commissions. Just to say, well, you've got to pay this too. I'm not sure why it would be that different.
You're gonna say that the wage earners have to pay it, or the businesses have to pay it, but
The
not the
business,
business
so
owners.
if I'm self-employed, I am the business.
Yeah, again,
I am.
I think there's a
myself.
debate there about how much of the incidence is really borne by the business themselves versus the employees.
Senator McCormick.
I was self-employed for many years. I had to pay a quarterly estimate.
Yeah.
And then I filed a state.
Yep.
Tax.
I always ended up owing the state money.
Yeah.
Those would be your standard income taxes, yeah, but you would also have to pay the FICA taxes, right?
Yeah.
Both sides.
Yeah.
Your employee share. So
I'm saying, I don't think it's all that complicated. Just you include this tax.
Okay.
Well, it's not included, it's not included in this version.
In the, okay. well,
Self-employed individuals are not paying into the system all of this.
Well, we'll make sure that they do. Okay.
I also would just note, I mean, that's one of the largest elements of the federal tax cap, right, is challenges in collecting federal self-employment taxes. It's difficult to find that report.
I think all the commission is doing is saying that the bill is silent to the question he's wrote.
Yeah, right.
Yeah, and it's unclear to me if that's intentional or not, so I'm just raising it.
I doubt it, and I have a note.
Yep. One thing that I would just note for the committee is, most payroll taxes, this one included, are a flat rate. Generally, the legislature prefers progressive tax structures, so that's just, again, sort of an interesting observation for me, especially if you're putting a cap on it at the Social Security cap, right? I'm not sure that that would be seen as a progressive tax structure. The positions that are in the bill are reflective of the discussions we've had in the other body for H66, which has a materially similar payroll tax on it. I think we can do it with 15 staff. 1 year is aggressive. It's probably doable. We generally ask for a year to implement a tax type. This would be one of the larger ones that we would have implemented over the last several years. So it's a little bit aggressive, but I think it's doable. The big thing that I might raise from this, right, is it's interesting to me to repeal the child tax credit. For members of the committee who were here last year, you'll probably remember that the governor had recommended a series of tax reductions in his budget last year that equated to about $50 million in total tax reduction. And we engaged with the legislature and negotiated on those things. And the legislature was really keen on the $30 million child tax credit, right? And encouraged the governor to take that compromise with about $10 million of the original $50 million package that the governor wanted in tax reduction, and then this $30 million child tax credit. And the governor took that deal. We accepted that compromise, and the governor signed that bill. So to now walk back that $30 million tax reduction would, I think, be frustrating to the administration. But I might focus more on just the interesting interplays between that group and the group that this bill tries to help, right? If you're going to take $30 million in taxes from the very group that you're trying to give the services to, that's sort of interesting to me. I also think that there is one group of people who will be significantly financially harmed from this that I haven't heard a discussion about today, which are the people who today have a full subsidy under the CCFAP program and get this child tax credit, right? So today they are, and I'm not an expert on CCFAP, but everything that I've heard today is that those folks who are under 150% of the federal poverty level have no copay for childcare. And it's not entirely clear to me what they would gain in the new structure in childcare, but they would lose $1,000 a child per year for everyone, for every child 5 and under. And again, these are the lowest income Vermonters who are at or below 150% of the federal poverty level. So I think that there can be significant impacts from repealing the child tax credit. I'm not sure that it's a one-to-one translation between those credits and people paying for childcare. And so I would really encourage the committee to be thoughtful about the impact on that group. I would also just generally think about, what this sort of happened at the federal level, right? They enhanced the child tax credit for a year. Everybody got excited about it. We had all of the advocates talking about what a great policy that was. and then they didn't continue, right? And we've had sort of a similar trajectory here, right? I remember the discussions in the legislature last year with many people who were advocates in this space talking about how amazing the child tax credit would be. My department has done outreach for that, right? We've adjusted our forms. We've tried to reach people who wouldn't normally file a tax return so that they could file it and claim a refundable credit. They are going to get it this year, right? As they are filing this spring, they're going to get that credit, right? And it's going to be impactful, right? At $1,000 a child. So to then take that away next year, not everybody's going to be paying close attention to what happened in the Vermont legislature to understand why either their refund dropped significantly or they started to owe money to Vermont, right? And that will be a challenge that will hit your inboxes. It'll be a challenge that will hit my department. It'll be a challenge that hits the governor's office. So I would really encourage the committee to be thoughtful about that decision on the child tax credit. I think that there are some impacts there that I haven't heard discussed today that are significant and should be considered.
Thanks.
Can I ask, do you ever do surveying or, I mean, better understand what people did with their tax credits or anything like that? So this is kind of speculative.
Well, speculative in what way?
That many of those people didn't use it for childcare related costs.
If they're under 150% of federal poverty level, they don't owe any childcare costs today under the current CCFAP program. I think it's a fair assumption that they didn't use it for childcare. Maybe I'm missing something about the current program of the bill. I'm very happy to take that feedback if I am.
I think you're right.
So everyone who got the child tax credit was 150% or less.
The child tax credit goes up to, full credit goes up to 125,000 of AGI.
Okay.
So certainly people who are at 150% of federal poverty level or lower would qualify. And they're getting the credit today of $1,000 a child, but they don't have childcare costs necessarily if they're qualifying for full subsidy under CCFAP. So if you repeal the child tax credit, those families are going to lose $1,000 per child per year. And it's not clear to me what they
I
came
have
up
that,
with.
I don't know if you were here, but people who are working and may be home, you know, working out different shifts, and are not, you know, have got kids at home and not using childcare, are gonna lose people that are not paying for childcare out of pocket. That 150% will lose that. That is assuming that they filed and got the money, which we won't know until May, maybe.
Yeah, we won't have the full picture until even after that. But I'm hopeful with A, the financial impact of what it would mean to file, and B, the outreach that we've done that we would have filed. So I'm hopeful we don't have a lot of people who qualify for that credit who are not filed. That would be disappointing.
You mentioned the 15 positions. Question I think has come up in the hallways is if this was funded through an alternative method, an existing tax like the income tax or corporate tax, would you see less of these positions needed because it wouldn't be standing up a new tax, or would about the same amount be needed just to manage that additional amount of resources that we'd be collecting in the district?
Devil's always in the details, right? And what does it actually mean? But I can say that, I mean, several million is for like IT implementation costs for a new tax type, right? So if what instead we're talking about is a change to another tax type, it depends on how drastic that change is. Is it a big change to the base? Is it a change to just rates, right? If it's something like just rates, we are not going to need several $1 million to implement that in our IT system, right? If it's a big change to the base, you might be talking about some kind of IT costs. So a big chunk of it is because it's a brand new tax type. It's going to be built like a new tax type in our system. The scope of it matters, right? We're talking probably 30 some odd thousand businesses. That's essentially our base for payroll withholding right now. So yeah, my short answer is if we're talking about a different structure that's not a brand new tax type, it probably takes less in administrative costs. I just don't want to comment to exactly what that is until I would know the details of that.
If this was based on an income tax rather than a payroll tax, would you see that as sweeping up the self-employed through the application of a adjusted rate on the income tax?
So if you did an adjusted rate on the income tax, yeah, you'd have certainly self-employed people pay personal income taxes, so that would capture that audience.
in your mind to raise approximately $100 million, do you know how much of a percent increase on the income tax would likely be?
I don't know, but the base for income tax for fiscal year 22 is about 1.2 billion.
Well, I don't know if this is for the commissioner, but I'm just looking at our FPL chart, just to make sure somewhere in our documents, do we have the exact impacts of repealing the child tax credit? Because if you're a family of four, between 150,000 and say 150% and 425% of FPL, you're likely benefiting from now a childcare subsidy. If you're at $45,000 in income or less, it would be helpful to know how much of a benefit that was that people would no longer be receiving. Is it?
Emily.
That's Emily. Emily is not here.
I'm here.
Eyes, I used to have people behind me
So is the
anymore.
question, like, what is the net benefit to somebody repealing the child tax credit and the benefits associated with the changes in the bill?
And the net cost if you're at 150% or less.
We haven't run that analysis.
Okay. I mean, I think that might be a question that we received, so it might be helpful to, I mean, that's our committee's sort of cost
Okay,
benefit.
on the other hand, you've got the people making 175% that are going to do a lot better.
That's what I'm saying. So
That's-
between 150 and 425% of FPL, you would be doing better if your child's in childcare.
Right.
If you're less than 150%, how much worse off are you? I can't.
Right.
If it's a tax credit, then it's still against your existing tax.
I think it's a refundable
tax credit. Okay.
Yeah, so, there's two elements, right? Because one, those people under 150% of federal poverty level are gonna start paying this payroll tax. So that's one way they'll start paying more, because today, again, they're getting the full subsidy under CCFAP under current tax law. So they'll start paying the payroll tax, but then it's how many kids do they have age 5 or under, right? At each one that they have, they're losing $1,000.
So that's a figure we can get.
We don't have the full picture of that, because this is the first year of filing, so we only have the filings up to what we have through today.
Okay.
And so tax would do that.
These are probably not people who file out.
No, I think we probably do have a fair share of early filers for this,
Okay,
right?
get a
Like
refund.
refund filers tend to file earlier, but we will not have a full picture. But I mean, certainly we can figure out how many current filers are under that, but
That's just better information for
Sure.
us.
we get that. I don't have it with me today, but
Okay.
I don't think that's difficult to do.
Okay. Send it to.
So we currently fund public education, which in a way is early education, in which we're talking about your early childhood education through property taxes that are paid for by commercial businesses, private residences, homesteads, both out-of-state homesteads. So that's drawing from a base of property taxes as well as some other sources that we could.
Sales tax and a third of meals.
So my question is, I think you said this in some of your remarks, we're looking at a payroll tax for the people that would pay for early childcare education would just be wage earners and employers. But it takes a village, and would it maybe make more sense to you to look at the income tax so that everybody, even out-of-state incomes that come to Vermonters here, everybody that collects an income in the great state of Vermont would then be funding to pay for our children? That makes more of a rational tax argument for funding early child education rather than just those that have a job that are earning an income and just those employers that are providing those. Do you see income as a more rational source for funding this new program?
I mean, I really see that as a decision for you guys. I just flag it as, it is interesting to me that it's, that's the base. For this.
All right.
Again, I don't think you're gonna find support from the administration for.
Yeah, I don't think the governor's going to
Ready?
support raising the income tax either. Part of the reason going to payroll is because so many employers have come in and said, we had them in economic development. I know they've been into health and welfare. They just haven't been here, but I can arrange it that they lose thousands of dollars a day in productivity when they've got a worker out, that this is an economic necessity. And we've heard that during COVID, that when the daycare shut down because of COVID fears, employers couldn't work because their employees couldn't come to work. So that was the rationale. One of the prime people usually have childcare so they can work, not so they can go. And you have to be pretty rich to have childcare, so you can just sit home.
I wouldn't counter any of that. My question is who should pay for it? And really, should it be everybody and not just the employers?
Okay.
Everybody that lives in Vermont benefits when our kids are cared for and educated.
Okay.
That's where I'm coming from.
Any questions for the tax commissioner? Okay, none now. Damien, we've had you. Do you have more?
I haven't walked through the new language yet.
Okay.
And Abby and I should do that
Can I
together.
put Megan Sullivan on ahead of you?
Of course.
We'll get an advocate or a disadvocate, whatever. Then we will have more in, but this is either coming out tomorrow. But if we don't reach consensus, and the other committees have done a lot of work on this, then the whole bill dies. So, and we stay where we are. And some folks will benefit, the lower income folks. They have their kids in childcare. And a lot of other folks won't, so, and the childcare centers won't.
Are you saying you want to vote today or?
We have to vote this week, and Approps needs the bill, so we are supposed to have 2 days on this bill.
So we could move the vote to tomorrow, but.
I'm not planning on voting today.
Okay, I wasn't sure. So.
But I'm just saying, we have not had a lot of time. I still, I don't seem to have anything else here that is particularly controversial. But the secretary still hadn't seen, because they came out late Friday, whether or not either the sheriffs or dispatch might come here, because they both have some monkeying with fees and payments. If they come here, we are under a huge, big crunch. Bring your sleeping bags. If they don't, we can play with this. But this is it. These bills didn't come out till last Friday. So Megan.
I will note that Tourism Day is tomorrow, and we have a lovely reception from 4 to 6, so it's all welcome to come up if you don't need your sleeping bags.
Maybe bring us some.
Cheese and ice cream, that's the difference.
And distillers, and there'll be lots of things.
No bills. We had a bill in here once that required that any reception at the State House or of the state agency serve milk.
I cannot remember tonight. I haven't looked at this. Anyways, Megan Sullivan, official title is Vice President of Government Affairs for the Vermont Chamber of Commerce. I appreciate the opportunity to come in and talk to the committee today about this bill. I have been engaged on this issue. The Vermont State Chamber has been engaged on this issue. We're part of the stakeholder community group for the RANT study, working with legislators and advocates both prior to and during the session about these issues, and was here last month to talk sort of preemptively with the committee about the potential for a payroll tax and looking at childcare and paid family leave. We'll note that that conversation quickly evolved into Vermont's housing crisis, which I think is very telling about what is the most important thing that the legislature can do for business and the workforce this session. But that is for a different committee at a different time. So I think if employers are being asked to shoulder the entire cost for this, we need to be really clear about what the impacts of the proposals will have on Vermont's workforce crisis and the amounts and sources of revenues to pay for it in that decision. In the bill, there is legislative intent added, and I believe it's number 4 that says will address the workforce needs for the state's employers. And so that's a piece that I'm going to keep coming back to. We appreciate that that's part of the intent of the bill, is to talk about what are the workforce needs for the employers in the state of Vermont. You know, and a few pages down, we notice that the relation between workforce and CCFAP has been removed, where there was language about CCFAP, people participating in that being because, you know, they need to go to work or need to go to training for employment. That language is no longer in there. So again, I come back to, okay, how are we then meeting this legislative intent that has been added, that we are going to address the workforce needs of the state's employers? When the RAM report was released, it stated that less than 1% of the workforce will change if these available changes. It will be available if these changes are made. And that was disappointing, but you know, a number based in reality about what this is actually going to do for our current workforce. Less than 1% addressed. Outside of the RAND proposal, though, and a study that hasn't been talked about in this committee yet, was a proposal by Senator Hardy related to making pre-kindergarten part of the public school system. And I think gets to some of the questions and concerns that have been raised by the members of this committee around adding so much money into a private business and concerns around whether it's profits versus, you know, what are we getting for what we're doing. Purpose, as I understand it, from listening to the testimony on that proposal, for can we add 4-year-olds and in the future potentially 3-year-olds to our public school system, which would cost less, would use available space in our schools, and would address the problem that we hear most from employers, which is the lack of availability. And so that has been turned into a study. And I think part of our concern there is that we still have a long way to go in this session. And rather than study that, can we dig into how to make that work and whether it's timeline added, but also from the initial estimates that the costs were much more reasonable. And you have teachers added to the public school system, which, as Joyce had mentioned, is where they're going and can provide the benefits of the region. So I think that is a piece that deserves further.
Can my people that have to leave, can we wait till Megan finishes and then I'm going to recess?
Oh, you are?
Yeah, well, I'm going to recess for a little while. We've been at this for over 3 hours. And
we have chairs at 4:30.
If they want this bill out.
Okay. I'm happy to not go to chairs. I just wasn't sure if we're recessing means
we
for.
will finish
Oh,
this
sorry,
up,
okay.
but.
Sorry, Megan. That's okay, I can wait. Okay.
No, if I've got to end at 4:30, you might as well go.
So we've heard interesting arguments about how this addresses availability and affordability with lower costs and a broader groups asking to pay. And so would ask if there's a way to continue to dig into that this session rather than do that as a study.
Again, dig into it here in this committee.
Or ask the policy committee if that could be put back in. If it reduces
I'm
the
having
cost
trouble
of the
with the
bill.
number of your members who have come in and signed on to petitions saying that childcare is an absolute need. They have to have it. And now we're asking to put this off for a couple of years to study it.
I'm not asking that it get put off. I'm asking that it be done. I mean, I think what we're saying is what we hear from our members is availability, number one. So we're looking at how does this address availability to address Vermont's workforce crisis? What are we doing to address availability? So when I see things, when we look at, well, we're going to increase the wages and that will add more spots. And at the same time, we're seeing 9,000 jobs just on one job site alone that pay over $45,000 a year. Availability of workforce is not something that childcare sector alone is
They pay
facing.
$45,000 a year for childcare?
For jobs across the state. So saying if by raising the wages of childcare workers, we're going to solve that crisis. There are 9,000 other jobs that are open that pay that much, that aren't getting workers. Where are these workers coming from? And I think we're missing that plan of how do we get from raising wages to getting positions filled when there are so many positions in every sector that don't have employees filling them. And so we're looking for what that plan is. Because if I'm going to go to my members and say, you're going to shoulder 100% of the cost of this, and there aren't solutions that get them to availability, that's an issue. So again, we're looking for what are the solutions that have been proposed that get us to that point of, is there availability? And the second piece is behind that is affordability. But availability is first. If you're still 30th on the wait list, even if you have a reduced cost, that is a problem. I think we see the piece around the equity plan of the STARS program, especially in our rural areas, as having a nexus with availability, but agree that guardrails are needed. And again, that brings us to the guardrails that are in that public education system. We'd love to hear more about what that plan could get us to.
Two things. One, I completely agree with you on pre-K, and I don't think we can do it in this committee with the timeline we have, but I hope that in the House, there's more advocacy to look more closely at how we could have our existing infrastructure in our schools lower the cost of this. And the other piece I want to say, which I do agree with you as well, I'm inclined to support moving this forward, but I've got to say, so you can't look at this just in isolation. You have to look at the end of the session, because when I hear from those employers, they're looking at the needs for housing to address the affordability pieces for the workers to provide this thing. So for me, this is only part of a total solution that will allow for everything Vermont needs to make everything easier, more affordable to stay in. Housing is at the crux of it. I don't know if that touches upon what you were just saying, but I think it's important.
Well, it is one of the costs that are keeping employees from moving. And we're not gonna make any difference there, so. That's right.
Sorry, it was, somebody else came back in, may have missed this in your testimony. In terms of your concerns around workforce, what, do you have a proposal to address the workforce shortage, not just for childcare workers, but more broadly in the state?
We would love to see the state invest some money in doing more around how do we elevate the achievements of what we're doing to bring more people into the state, to let people know that the state of Vermont is a place that has opportunities to live and work.
And you guys at the tourism, there's some tourism forum tomorrow morning.
Yes, we will. We're very much involved in that.
Good.
But we're looking for people to stay here, to live here.
Yeah. No,
and
but
we
I mean
know
that
it's-
whole advertising, because we advertise for tourism. We don't do much of anything to advertise for residents in that
And
this is what we have.
We would love to see that.
And
Because
these-
I've been
Really
told,
don't want to give up anything for housing.
I continually to be told that when we make these investments, people will move here. If we have paid family leave, that will be an attraction for people to move to Vermont. If we have this robust childcare system, that'll be an attraction for people to move to Vermont. But when we look at the data of where people are moving, the states people are moving to, and this is based on USPS, Florida, Texas, North Carolina, South Carolina, Tennessee, Georgia, Idaho, Montana, Delaware. Places people are leaving: New York, California, Washington, Rhode Island, New Mexico, Pennsylvania, Illinois, Colorado. So it is not clear that investing in your social safety net is a way to attract more people to the state. And I don't see anything in this bill that is about investing in attracting more people to the state, whether it's to use these programs or to work in these industries.
So on that list, I'm not sure, you're reading it differently than I am. I mean, because somehow you know more about that list than I do. So I just hear those states, and then I don't know how are you characterizing the group of states what do they have in common? The states where people are going, and what do the states where people are leaving have in common, and how does Vermont compare to those two groups? I'm not able to
Right.
complete all the dots.
Right, well, there are, I would say, lower tax rates in many of these states. And in terms of paid family leave, I think on the list of places people are moving, Delaware has approved a program that has not started yet. But no other states in the states where there are people moving to.
Okay, but I think what we can say is that Vermont, we've lost some on the census. The word is during COVID, some people moved here. But we have not seen a big influx of population on any standard. And what we do hear, we hear stories of people who have come and not been able to find affordable housing, who have accepted jobs here and haven't been able to stay. We actually lost a ledge council back when who agreed to take the job and couldn't get her family resettled in time to help out education. We got somebody else that was already here. It's been an issue for a while, but I don't know why.
I think my point is that to classify something as this is going to be a workforce solution, or it should be paid just by employers because this is going to be a workforce solution. We are not seeing that, whether it's the RAND report saying less than 1%, or that people are going to move here. That doesn't represent what the national migration trends are. And if we're not telling people what we're doing, certainly it gives them even less case to come here. So when we're talking about how do we pay for these things, well, let me back up, because this bill also includes the paid family leave. And we appreciate there's an alternative to the House's plan for paid family leave, but we're
Employers are paying for that.
I think that's part of it.
No, the 100,000 we were told to raise was for the childcare. My understanding is that Senator Kitchell is using the child tax credit money and some other monies to pay for that. I know, Damien, do you know, that's what I've been told, but things change rapidly.
So what our instructions were on drafting the payroll tax was that it was to be used for, designated as being available for both. That was my understanding. I may have lost something in the translation. As I was saying before, this is all open to amendment. But right now it says for CCFAP and for the parental leave benefit. So it designates those funds for that purpose.
Right.
Am I missing anything, Emily and Abby?
Was the question also about who is paying the tax?
The child tax credit, we had we got $270 million, and it's been down to $100 million for the basic child care program. Before anything about a child, family leave was added on. And so coming up with that $100 million with the payroll tax was the base idea. It's what was proposed with RAND, and then they supplemented it with a few other suggestions like move the sales tax to medical services. We didn't think that would be quite acceptable. But it's the employers have not said to us, they've said every time I've got an employee out because there's no child care, I lose $3,000 a day in productivity. I've got somebody who's not producing it. It was seen as a present necessity, not as attracting new workers. So I I'm not sure what to do if we just delay another year. Things are only gonna get worse. I mean, we can kill this bill if that's what people wanna do with it. Or we can find an acceptable way to move us forward. This is a huge step. We're actually gonna pay what it cost. Which will allow a lot more families to afford childcare. And that seems to be some of the reason they aren't coming back. They figured out they didn't lose that much by staying home with their kids. So I don't know.
No, I mean, that gets to that ran less than 1% number, that's who's staying home, how many people are we talking about? They're saying less than 1% are going to be available to the workforce.
So we're gonna charge employers 1%.
Less than 1%.
Well, we're actually gonna charge you less than 1%, I think, when the numbers crunch, but.
So I just.
No, I mean, that is of the present workforce, you're right. We don't have enough people right now to fill the jobs. I think the statistic was by 2050, we're gonna have more senior citizens than children in this state.
JFO said if in their report this year, JFO's here, that we either need to get rid of all of our senior citizens or import a lot of young people, and
yes,
I'm getting appreciate all of the. We greatly appreciate the contributions of our mature workers.
Out of my home,
I know.
When there's no place for me to go but into a quadruplex and an eighth of an acre land, maybe in 10 years. I mean,
like to see
we've got to decide where we're going and how we're gonna deal with this, because Vermont has essentially not grown since I moved here in 1975. It grew some in the 60s and early 70s, but it has not grown since then. And I'm not sure what to do, but those of us that got here have aged. And we see it in state employees. We have more, more retired than we do working. I'm not sure what we're gonna do with it, but we sure don't want to discourage anybody from having kids.
Well, we did, since the last census, we had about 20,000, so it's not as dire as it was flat. 10,000 more from 2010 to 2020.
Montpelier's lost 300 residents since I was the mayor.
Well, I know there's, well, I think Chittenden County's grown.
That's
probably.
where you picked it up.
And I think there's a net, but there's a net gain, and then how it's distributed is there.
Right.
There's some, Bennington County, for instance, and Rutland counties have lost.
Yes.
A lot more people.
And Washington County has remained flat.
That's a question, the chamber.
Yes.
Does the chamber have an opinion on the income tax? I'm betting you probably don't want to see either, but between a payroll tax, employer tax, or income tax, is that something that you were about to get to in your testimony?
So I will get there. I do want to say we have concerns that there has not been testimony taken on the policy of the proposed paid family leave piece of this legislation. And that there are considerations around things like small business exemption, the length of time an employee is employed before they're qualified for benefits that were part of the 2019 legislation that we haven't been able to discuss on the policy side. And while I'm sure there will be opportunities to discuss that policy in the House, we would have loved to the opportunity to discuss that policy on the paid family leave piece in the Senate. Because the cost to a business when they have an employee go out on leave is significant when they can't find someone, or even if they can find someone to be paying for a temporary employee.
Wait, I missed where.
Yeah. I was
You wanted
making a
paid
note
family
that
leave too, or you don't want to.
I was making a note that there was not an opportunity to talk about the policy being put forward in the paid family leave piece of this bill.
Okay.
So without that opportunity to be engaged on the policy side, there were pieces of the proposal that we could not provide testimony on, like a small business exemption.
Okay, do you want to be prepared to do that tomorrow in here?
I'd be happy to do that tomorrow.
Okay, then we will get Megan on and we'll take testimony on that.
In the qualifying time period in the bill, it's 30 days and then they qualify for this? They've been employed for 30 days?
No, they just have to have been employed within 30 days before the leave starts.
And is there alternative suggestion you see elsewhere in the country where it's 6 months, a year, or so on?
Well, in 2019, I believe we agreed on 2 calendar quarters. And I can look back at that, or you might.
Right, so we've had a variety of different proposals, and states around the country use a variety of different measures. The House proposal and the proposal back in 2019 had 2 of the last 4 calendar quarters. The House proposals evolved a little bit from that. It's 2 calendar quarters in the prior year, or two of the last 4. That got to documenting basically that there were contributions paid for the employees. So that's where employees and employers are paying into the system and then theoretically
And
taking
that's
out.
full paid family leave.
Right. In other states, it varies. In some states, they measure hours. In some states, they measure earnings. Typically, the thresholds are measured by level of earnings. So for example, in Rhode Island, it's currently roughly $2,600 during the base period. In California, it's only $300 during the base period. So that's California is the lowest. Massachusetts has 6,000 in the base period. Connecticut is 2,300 in the base period. Gives you a sense they're kind of all over the place. But they're looking at earnings, typically for job protected leave, which is the other half of this.
Media earnings.
Sorry.
I'm sorry.
Trying to turn it
There
off.
was a rule in the legislature that we were not supposed to be using our electronic devices for anything other than looking at the presenter.
Then I am busted and
Your predecessor in that seat got busted for having some really good information that he Googled.
I really, when that happens, you just have to bring muffins to the next meeting.
I'm gonna put a little jar for the chair.
It actually was legislative work. It was not this particular one. And since the
No,
chair
this
saw fit
particular-
not to take a
this-
break, since we have to take a break, I meant.
We are going to take a break. Anyone can take a break anytime they want. We are about to take a break because I don't think we're gonna make any progress, so today.
Madam Chair, I apologize to you and to the committee and to the.
I would, speaking of the person who's sitting next chair, which I believe is Senator Pearson, unless I've got the room wrong.
No, Pearson
Oh,
was
never
here.
mind.
I'm
Sorry.
thinking of Senator Campion.
Oh, okay. One place where I think I will take a different opinion than the tax commissioner is that we fully support seeing the child tax credit being used for childcare and for the solutions being proposed for childcare. Last year, we raised the red flag, and Senator Pearson was with us on this. It's an interesting combination there. That this was coming, the childcare, the RAND report, that this was coming this year. And that losing that tax capacity, when we're talking about what is the largest cost for families with children under 5, that is childcare, and we should not give up the tax capacity to use that money towards childcare in the future. So we very much support using that money towards the care of the child, and think that is, that it should have been put aside, whether put aside or put directly to childcare last year, but should be used for childcare this year.
Okay.
And a payroll tax, we would like to see that, as it was done in 2019, be a contribution from the employees that the employer has the option to pay some or all of. Can be an important way for an employer that has hard jobs to attract as an added benefit employees by offering that, and an opportunity for those employees, as I believe an employer for when the head of Healthy Living was in here testifying, talking about the different types of margins that businesses, especially small businesses, operate on, that it can be incredibly challenging to have that additional.
On the other hand, low wage employees operate on even tighter margins. And so I suppose if the employer that only pays minimum wage wants to pay more than payroll tax, we're trying to find a way where if the employee pays in and they can't afford to take the benefit because it doesn't equal their wages, which I have them under stress anyway. Wages in general in this state are low, and the cost of living is not. And that's a good part of our problem. And I'm trying to find a way that people with money can find a way to stay home with their kids for 6 weeks or 12 weeks. And people that have employers that offer vacation or family leave, the ones that get caught are the ones that have nothing and make almost nothing. And I think this is trying to address those workers, the guys that stock the shelves in the grocery store at night. And I'm not sure how we do that.
Well, I think if we look at the $50 million that the governor has put on the table and the additional.
The governor has also level funded all the home and community-based services, so we're gonna have to find that money somewhere.
Right, well, I think sorry, I keep pointing because it was up there, the JFO sheet that I've seen shows that $50 million being put towards this.
It is being put toward 46 of it is.
Okay. So if we
That's the
take
one I saw.
the 46 and then the 32 of the child tax credit, I think we are making significant.
My books, because of the notes that are getting passed. No, they're not electronic. They are equally distracting. Okay, let me find my spreadsheet, which is under the notes. All right. Okay, no, this is
49.
Yeah, 49. It does.
So 49 plus the 32 is a significant increase. If we're spending 125 right now, which I believe is the number that Rand said. 125 right now, and we're increasing 80.
It's a significant, but I don't know that it's enough to put a dent in the problem. We can see if we can run it overnight, but it's not half of what we need to come up to 63% of what it cost. The cost over, 100 million, we're under.
Well, and again, I would come back to what is the cost of some of the other solutions that have been proposed, if those are less.
Is there a dollar figure on what the pre-K thing was proposed to possibly save in these costs?
I had seen 20 million. I don't know if that came from JFO or who that came from.
And then, while I still have the flourish, I will also ask, could you clarify, you said you want to see the employers have the option to either pay the entire payroll tax or just the half. You didn't ask for the employers to put the entire payroll.
In
tax.
2019, it was in 2019, the way that the paid family leave bill ended was that it was a contribution by the employee that the employer had an option to pay some or all of.
And it didn't pass.
Well, it passed, it
didn't
was
pass,
vetoed.
it lost the
But this
veto.
body approved it.
Right. But that was the one that Senator Kitchell made a very heartfelt, she voted no, which was very hard, for the base reason that we were charging, low-wage workers for a benefit that they could never afford because it only paid them 2/3 or, but not their full wage. And that's why she's come out with this proposal, which would cover full wages for people in those lower income brackets that otherwise can't afford to take them. And, if the employers, to me, would be the prime beneficiaries of this. Maybe they'll only get 1% more workers, but they'll have an easier time keeping their workers. And they'll have fewer days off because my mother's sick and can't watch the kids. And they're the ones that have been out there, they're the ones that have been signing the petitions. And now they want their employees to pay for this, and that doesn't sound fair.
Well, I think what I am saying is that we would like to see that that what is being proposed is going to lead to those solutions. And so whether there's those legislative intents, that there's a check back, are we meeting the legislative intents? Are we addressing the workforce problem?
We'll probably have to put checkbacks in. We're gonna need to check the costs of childcare and what's happening to it. We're gonna have to check whether or not this brings either increased slots or new centers online. We're gonna have to watch this regionally. We're gonna have to do some monitoring.
That monitoring ought to be independent, so that we don't have the people who are responsible for the
That's
program.
another $1
telling
million.
us how it works. But that's the typical thing we do. We have the people who are responsible for it come back and tell us what a great program it is, as opposed to having an independent check back that really determines, are we accomplishing what we have? And that's the whole issue of accountability.
Well, I think this one, if we just look at numbers, we might be all right. We got more employees? Have we got more centers? We're not, I'm giving up on getting more people into the state, but.
We have other ideas on how we can do that.
I'm sure there are.
I think, as we're seeing with the child tax credit, though, when you make these investments, it is then hard to say, we need to change them. And that's, we saw that Maine raised the wages of their child care workers and then came back and said, it's not enough, we need to raise them more. And so that, if this comes back and says it doesn't work, well, we should raise wages even higher.
We don't know that.
Nope, but
and to wait,
I don't think we're
to
saying
try and
wait.
predict the future, we just do nothing, which is an alternative. But if the employers are gonna get a much less friendly ear from me if they've done all this lobbying for childcare, but then when it shows up that it might cost them money, they're saying, but tax my employees, don't tax me. I'm gonna have a hard time listening. This has gotta be.
And I think the Vermont Chamber specifically did not endorse any specific proposal because we said we need to understand what the proposal is. Does the proposal clearly show us a path to solutions based on the problems that we are hearing? And is the cost of that reasonable? So there are organizations who.
Have a proposal for how we solve the workforce problem?
For how we bring more workers. I would love to have Kevin Chu come in for the Vermont Future Project and talk about.
There is a workforce bill out there somewhere.
Yes, there is. A workforce training bill. Yep.
Oh, training. That's not the same. Okay. We can't do that now. We're not gonna get any farther on this bill, so I think we're gonna recess, be back in here. I guess we're on the floor at 11:30 tomorrow. we'll be back here at 11. We'll be back here a half hour after we get off the floor. I would like to hear from all of you, from who you would like to hear as witnesses, because this bill is either coming out tomorrow or it's not gonna be able to come out.
Is it your intention that the bill will come out of here with an intact funding scheme that we've embedded there?
My job is to fund the program.
Well, the tax committee,
If
that's not-
there is no funding, then we've killed it, we might as well not put a bill up. We have to have,
I have no objection to this committee doing the funding. That is our job. I do find it a bit surprising that we're supposed to do it in 48 hours.
that is the way it works. That's the way this has been set out. It's been known, the RAND study was there. We had testimony early on. And we had, the RAND people came in and I think twice told us what the options were. I haven't seen any other options. Well, I've got one, we tax the employees. And that, since that's one that I know would probably get it killed in appropriation. So think about what would be an equitable way that you could live with to fund this. And try and keep it, payroll was looked at because employers are the prime beneficiaries. They get employees. Whether or not those employees were gonna get more people to move into this state is beyond the scope of this bill. There's several others that might help, but they're not going.
There's one question that I had in all this, to accomplish the end result in 24 hours, I think is unrealistic, but I've been concerned that we have seemed to listen to a very small subset of employers. We have not heard from the large employers around the state at all, at least I haven't. Perhaps someone else has. We've heard from the people who are from businesses for social responsibility and similar kinds of organizations that have a particular bent, but is not necessarily that of other particularly larger employers. I'd very much like to hear from some of those, one way or the other. And whether or not we can accomplish that in so short a time, I frankly doubt.
Ideas. I mean, I think a lot of them, they know it's out there. It's definitely, it's on the CBS Evening News.
But have not spoken up one way or the other.
Yeah, and it may be that's just their choice.
It
It's
may be.
got,
Or it may be the hope that it dies a natural death.
I mean,
As opposed
well,
to actually
but if
saying
you
that it's
have
something
any
that's going to
ideas,
help their
see if we
business
could
and
find
the state as a
some.
whole.
Right. Of the 10 businesses we heard from in economic development through Let's Grow Kids, ski area, On Logic, one of the largest employers. I mean, we tried to make sure we had a mix of large and small employers. I don't know if there's a type of employer you felt like was missing, or just who are the large employers that you'd want to hear from? Like,
Things like Global Founders, things like those employers.
Are we finished with Megan? 'Cause Megan's finished with us.
I just want to make clear, we're not opposed to the bill. We are asking questions, and asking, we know that childcare is a challenge for employers. We hear more about housing, but we also hear about childcare. And what we're asking for, again, is that the proposals lead to solutions to the problems that we hear most about, and that the cost is then something that we can share with them because it's creating these solutions. And so the questions I'm raising today are saying, how are some of the things proposed getting us to these solutions?
Okay. And I think Emily has a record.
Yes, just there is, Senator, when I was testifying, Senator Chicken asked a question about the childcare tax credit and the length of time that it was supposed to be in place. And if it was sort of a two-part question. How long has it been in place, and was it related to one-time funds? And I just wanted to clarify, it's been in place for 1 year. And that it was not related to one-time funds. It was, the intent was it to go forward.
Yes.
Until the legislature changed their mind, but there's.
And what we don't know is
Some
how well people heard that. A lot of these people may not even file taxes. We won't know probably July maybe first. We have to fix. So we don't know, but yes, there will be a negative impact. Some people got a real bonus for 1 year. And that got discussed when we did the credit, because the purpose really was trying to help with childcare. But, and if you don't send your kids to childcare, you got a really good bonus. But that, there aren't too many people that don't work that are under that umbrella. Okay, I'm gonna scoot over to Chair's meeting. We will meet here a half hour after we get off the floor. Feel free to bring your lunch. And let me know any witnesses you want to hear from. We're gonna have to sit down and hash this out and see if we can get it out of here. And I'll see if I can get any more time from Health and Welfare, but they're taking housing up on Friday.
Ropes is
Yeah.
Health and Welfare?
No, if I can get any leeway from approach to,
I think they pushed housing to Friday because of all the bills that they.
yeah, so I know they've worked on this, but if we
Yeah.
do any changes, they will have to redo it. So think about it, and we'll get going. Okay. Thank you all.
So did I miss, I'm okay going off live. I was just curious if I missed Damien and Abby.
No, we
Okay.
haven't, and I apologize.
Yeah, I just didn't know somehow I missed that.
No. And I think you guys are just gonna, we've got, I know you drafted.
We did have some other questions that we wanted to flag as well.
Okay.
I don't know what.
Can you send an email to Jill and she can send them to the committee? Or there's something, we'll put you on first tomorrow if we can get you.
Yes.
Okay. If it wasn't for the chairs meeting, I would keep us going, but I have a feeling we could all use a break. And if I give everybody a half-hour break, I'm really cutting into use, I'd rather do tomorrow. Okay,
I don't know if we can make that.
okay.
Tomorrow afternoon, I can do.